Namaskar, Swagatam. We would like to welcome you all on our 459th journey today, 58th journey today. Without your guardianship, mentorship, guidance, and support, it was not possible. I am really thankful to all for joining today. I would like to communicate my sincere thanks to Dr. Vishnu Prasad Sharma ji, Dr. V.K. Agnihotri sir, today's speakers, Dr. Rajendra Prasad ji, Dr. Hema Malini, Dr. Dhaivat Vora, and Dr. Swagat. All are welcome, and all senior dignitaries joined in the audience. I welcome them all. Welcome, sir. Welcome for celebrating World Heart Day. We are celebrating every day with AYUSH. This journey was started in Corona pandemic. To negate the negativity of that pandemic, we started everyday celebration. Previously, we conducted webinars on lifestyle disorders. And then every day we are trying to relate celebrations with our AYUSH, Ayurveda. And today we are fortunate to have Dr. Rajendra Prasad, Dr. Swagat, Dr. Dhaivat, by the way, Dr. Dhaivat Vora is my classmate in Jamnagar. Welcome, Dr. Dhaivat, on the platform after 1 year. I did my MD in 90. We did our MD in 1989 under Professor Hari Shankar Sharma, myself, and he was in Kai Chikitsa. So welcome. Now I would like to invite Professor Vishnu Prasad Sharma ji for his welcome blessings.
Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri ji, respected Dr. Pawan Kumar Sharma ji, distinguished guests, eminent speaker. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on heart care, the Ayurvedic approach. So in this evening webinar, we have eminent speaker, Dr. Rajendra Prasad, Professor, Department of Kaya Institute of Medical Sciences, Benares Hindu University, Varanasi. I welcome you, sir. Next, Dr. Dhaivat M. Vora, Professor and Head, Department of Shastravitta and Yoga, Parul Institute of Ayurveda and Research from Vadodara. I welcome you, sir. Next, I want to welcome Dr. Hema Malini A, founder, Ayurvedic Holistic Healthcare Center. I welcome you, madam, to this evening webinar. Next, Dr. Swagat N, Professor and Head, Department of Kaya Chikitsa, SRS Ayurveda Medical College, Agra. I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this important evening webinar on heart care, the Ayurvedic approach. Once again, I welcome all of you to this evening webinar on heart care, the Ayurvedic approach. Thank you. Namaskar. Over to Pavanji.
Thank you very much, sir. So nice of you for your welcome blessings. Now I would like to request for initial blessings for Professor V.K. Agnihotri. Then we will invite our first speaker of the day, Professor V.K. Agnihotri. Kindly unmute.
Thank you, sir. Thank you, sir. Thank you, Dr. Pawan Sharma ji. Very good evening to all of you. It's my pleasure that today we are celebrating our 458th webinar, and that too on topic the heart care on the World Heart Day. Actually, every organ, every person, every system, every cell is important. And with no reason, I have to admit, and we have to admit, that our cardiac day is every moment. How can a day be seized as a cardiac day? Because without cardiac, there is nothing. Without cardiac activity, there will be nothing. So, where should be the heart and what should be in the heart? This is very important. And when we go through all the epics, we got something very important. As today or nowadays, our Durga Puja is running, and there we very humbly go for the Hedanyas. The Hedanyas itself gives a lot of information, vibrations, and communication for the positive energy coming from the goddess deity Durga Ji. And not only this, we cannot limit ourselves here itself. When we talk about the heart, from where we should get the information? We just found one reference from our Ramcharitmanas written by Sant Tulsidas Ji, and he indicates that what Hanuman Ji told. He told, "Pravisi nagar kije sab kaja, Hriday rakhi Koshalpur Raja." So the Hriday, the heart, is the place where the Koshalpur Raja, means Lord Ram, is supposed to be there, who is the great Margdarshak, everything of Hanumanji. And at the same time, what Ramchandji thinks, he thinks, Guru hi pranam manai manikina, ati laghav uthaye dhanulina. The Guru is supposed to be there in Man. So the seat of Man is the Guru, and the place of Ramachandji or the east is heart. Rest, ventricles, auricles, and whole of the circulatory system, all in the Nilay, purified blood, impurified blood, happening so many ISD, CD, everything is there. But from the spirituality point of view, as we all know, there is also a spiritual medicine. So a person like me, and having the completed this much of age with the experience, we have got no hesitation to say that without God, without Guru, nothing is possible. And Guru like Hanumanji, Guru like Ramchandji, everything will be safe. So with these initial words, I wish to hear a lot of good information from all our distinguished speakers today on the cardiac care, with a special reference to the Ayurvedic support. Otherwise, every day, every moment is directly related with the heart. Thank you so much, and welcome all our distinguished guests along with our all dignitaries who have joined today's webinar platform. Thank you so much. Over to Dr. Pawan Sharma ji.
Thank you, Agnihotri sir. Thank you very much. Now I would like to request Dr. Rajendra Prasad, Professor, Department of Kai Chikitsa in Faculty of Ayurveda, Institute of Medicinal Sciences, BHU. Welcome, Dr. Rajendra Prasad ji, first time on the platform, and we request you to please do join whenever you have time and topic of your choice. Welcome. Now the stage is yours.
Good evening, everybody, and very, very thanks to Dr. Pawan Sharma ji. And here in the guest or in the group of organizers, I am delighted to have my teacher, Professor V.K. Agnihotri ji. He has been really my teacher in UG classes. Then I have my teacher equivalent, Dr. B.P. Sharma ji. He is more than a teacher for me. So I am very lucky to hear and feeling very much delighted to the part of this record-making series, that is AYUSH SAMRIDDHI. Today is 458th lecture, and I am lucky to be here. So, World Heart Day, I don't say celebrating, we are focusing, we are pointing over the heart care, and it is very rightly said by Professor V.K. Agnihotri, because not only day, but each and every moment, each and every second is with heart. Without heart, we cannot live a single minute or single second. So all the time, in all the moments, we have to take care of the healthy heart. And as we are looking, we are facing many issues, many problems, that every day many people are there dying of this, the grave disease, heart disease. So each and every time we have to take care of this. And today on this platform, we will be sharing something, some my experiences on the heart care, especially with the help of Ayurvedic medicine and Ayurveda. So I would like to share my screen. I think my screen is visible now.
Yes, yes, you can go for slideshow.
Yes, sir. Well, so as we are discussing regarding the heart care, the heart elements. So the importance of why we need it, why we are focusing on the heart illnesses, heart disease, especially the today day of the 29th of the September. Its importance, everybody knows how it is important, how it is important. And the few days back, it was the highest cause of mortality, cause of death due to cardiac diseases. But now it came to the second, as the highest is now the cancer issues, cancer problems. But it is very important. And main thing is that we can prevent it. We can adopt some measures, prophylactic measures, so we can prevent it. That's why it is very important. Its causative factors, they are visible, they are very known, they are very, we can say, black and white, in the form of black and white. They are here, that we can avoid. So that's why it's very important. And now the second thing is that the morbidity increasing day by day in the young people. Previously, it was accepted, it was taken as that it is a disease of old age. People having the age of 50 or 60 years, more than 50 or 60 years, they are getting affected with the heart disease. But now what is happening? It is not the absolute rule. Now, many young people, they are even of 20 plus, 20, 25, 30, 35 year of age, they are getting trouble with the cardiac, and many of them died, expired. So it becomes a very important thing, very important issue. So we can take care of that, and definitely we should try our best to treat them or provide them the best treatment, best modalities. Many people from us, and recently many people died during exercise, like Raju Srivastava. Many people are there, they are getting affected, they are getting died. So it becomes a very important issue to take care of it. Then the recent data of that, we can say the year 2021, there shows that 50% of cases who are getting affected with the cardiac disease are less than 50 years of age. This is very important thing. And among them, 25 to 26% cases are there who are under 40 years. So we can say that it is a very large number. Many young people are getting affected, getting died. So that becomes very important. Then the causative factors or the etiology behind the cardiac disease is well known to everyone. Why it is happening. But here I am discussing the etiology behind the young person, why they are getting affected. So in my opinion, or in my study, I can say few things are that addictions are getting increased day by day. Definitely the form is changed. Many people are that they are not smoking, but addiction is in different way. Maybe some pan masala, maybe some alcoholic drinks, or many other things. Even many drugs we are coming across in the film industry, in the VIP, in the high society, they are getting addicted to the drugs, many things. So they can be responsible for that. Obesity, altered daily routine. The altered daily routine or the lifestyle is very much faulty, we can say nowadays, especially in young people. They are busy in their career making, their study, their professional preparations, many things, and due to which they are not focusing over their proper health, proper daily routine. I'm having many of patients, the students, we are doing the medical graduation, medical post-graduation, IITians, engineers, managers, even MBA students, they are pursuing their management degree. What they are doing, they're going to sleep at 1 a.m., at 2 a.m., and giving up the bed at 8 a.m. So it is very faulty, very defective. And that kind of abnormal sleeping and abnormal awakening in the morning hour, it is very much harmful. It is fully or clearly described in Ayurvedic classics that if that kind of daily routine, that kind of dincharya is being adopted by anyone, it will definitely affect, definitely vitiate the dosas like Vata, Pitta, Kapha. Ratri Jagran is typically responsible for this Vat Prakop. We know, and Vatic disease, Vatic Hridaya Rog, they are very common. So in that way, the people, young people getting affected due to that routine and due to prolonged sitting. Just after taking meal, they are doing their job, computer job, lot of screen times, and getting obesity. That obesity, previously it was not much in young people, but nowadays we are very frequently observing in the young people that they are obese, they are overweight, that obesity is proved risk factor for cardiac disease. Then this very important improper exercise and gyms, etc. These are the very recent examples. Definitely, at first moment, young person, they are careless about their health. Then secondly, when they get obese, they can get even diabetes also. They can have some symptoms of cardiac illness, some risk factors, maybe dyslipidemia or hyperlipidemia, it is there. Then they start thinking that I have to maintain my health, I have to go for gym, for exercise, where many people, they are not getting proper training from the gym trainer, we can say physical training instructor or physical educationist. Without their proper training, without their proper instructions, they are doing the exercises, their gym activity, and that kind of gym activities are causing immediate death to those them. So it is very common. These are four things are very common in the young people, why they are getting the heart disease, why they are getting untimely death due to this cardiac problem, cardiac issues. So in that case, it becomes very important to discuss all these things, not only this World Heart Day, but every day in every clinic and every center. In Ayurveda, we have seen that the cardiac illness or the heart disease, they are very minimally described, very less, very little description is there in the Ayurvedic classics, in Charak Samhita, in Sishu Samhita, and in other classics. But it is scanty, it is scattered. We, from the Department of Chikitsa, we have to collect it, we have to assemble it, we have to interpret it and utilize it. So we are trying our best to do all these things because it is very important. And then in modern medicine, there are many limitations are there to treatment of the cardiac disease. Immediately they go to they refer the patient to the cardiac surgery. Many patients, they are not suitable for cardiac surgery, or they are not willing to get cardiac surgery. Those people and many people who are willing to get Ayurvedic treatment, they are coming to us. So due to that demand, that need, we have to search for best possible modalities from Ayurveda. We are collecting the knowledge. As far as the etiology concerned, we know the dietary factors, lifestyle factors, or psych-related factors. These are the three things we can summarize, we can compile from the Ayurveda side, means Ahar Sambandhi and Vihar Sambandhi, and the Mano means psyche, something related to brain. Anxiety is a very important cause in these cardiac illnesses. Then if you go in the classics, these are the very common things. We have many of you Ayurvedists, they are already knowing what is described in classics, that excess hot food, heavy, high calorie, Means many things, classic things are there. It are already described. I have just compiled from the classics. I am not going to detail. Then lifestyle related, it is something, some extra information from the Ayurveda that as modern medicine it is described that lack of physical activity or lack of physical exertion gives to the sedentary lifestyle and the obesity and ultimately cardiac disease. But in Ayurveda, it is not. It is written in the both ways that excessive physical exertion or no physical exertion. Means no physical exertion in the modern medicine, but in Ayurveda, no physical exertion or excess physical exertion. Both can cause the cardiac illness. Excess means they are taking less calories, their diet quality is not good, but they are performing exercises. This kind of example is also proved in the recent studies that many young person, many people who are going to the gym doing the morning activities, and they just think that if I am going empty stomach without taking anything, then the exercise will be more effective. But it is not all the time it is truth. If you are doing the light exercise, just walking, then it's okay. You can do empty stomach. But if you are doing the grave exercise, you are, I can say, strenuous exercise in the gyms, then that should never be performed empty stomach. There's you might have taken some little calorie supplement, little food, or little something should be in your stomach. So in that case, we can say in the Ayurveda, it is written like this, that excess physical exercise is equally important to cause the cardiac illness, similar to no physical exercise. So other thing, holding natural urges like Vidharan, and many factors are already there described in the Ayurveda that we can adopt, we can study to discuss the cardiac illness or the preventive. Then the other things, how they can cause the disease, it is a little bit my approach, why you can see that avyayam, how it can cause, ativyayam, how they can cause. Many things are the classical knowledge that I'm not going to detail. As far as psychological factors, unnecessary things, anxiety, fear, terror, misconduct, grief, they are very common things, and they are causing not only cardiac illness but many other illnesses also. As far as types are concerned, Vatak, Pittas, Kaphas, it is there written. And as we have to correlate it from Ayurveda, so we should have some knowledge, classical knowledge, what is described regarding the heart disease. So these are the common features described for the Hriday Rog in the Ayurveda, like discoloration, wavern, pain is there, we know everything. And discoloration, this discoloration we can take from the feature of discoloration, means like it may be pallor or it may be cyanosis. We see in many cases of cardiac illness, there can be a central cyanosis or there can be peripheral cyanosis. So this coloration can be taken up with that particular feature. Even the fever is described in cardiac Hriday Rog. Here in cardiac illness, normally we don't find fever. But in case of rheumatic heart disease, we know rheumatic heart disease is also a kind of Hriday Rog, also kind of heart disease. There we find the intense fever, prolonged fever is there in RSD, it's kind of infective. So many symptoms are there that can be easily correlated with the Ayurveda and modern medicine, and some of are not there. So if whatever is possible, we have to do, otherwise we should take care of our in Ayurveda. Then if we see the specific features, Vatic type, Vat, we know where is Vat, there is pain. Without Vat, no pain is there. And in cardiac illness, we know the ischemic heart disease, maybe angina, maybe myocardial infarction. Basically, their pain is the dominant feature, along with sweating, palpitation, pain referring to the shoulder, jaw, left hand, and other places. But among all, the pain is the always dominating feature, symptom. If we see in the Vatic type of Hriday Rog, which is described in Ayurveda, there are different kinds of pain that are described, like ayamate, nimathate, diryate, sfutate. All are the different kinds of pain. So we can say that Vatic Hriday Rog are the actually very nearer to the ischemic heart disease, maybe angina, maybe myocardial infarction. Other features are there that can be sometimes correlated or sometimes not. In pathic, some features can be correlated with the modern medicine, excessive thrust. Sometimes it is present in the acute attack, and other daha, burning sensation in body or heart area. It is described in a case of pathic Hriday Rog, and practically I have seen many patients, or theoretically it is written in modern medicine, that many patients of acute myocardial infarction, they don't have any symptom except burning sensation in the chest area, precordial area. When the patients goes to the emergency or any doctor, many times they are misdiagnosed or they are confused with the symptoms of hyperacidity. The doctors are giving them antacid drugs, maybe local systemic or something else, not giving them coronary dilator, and the patient died. So it is very important symptom that if patient is having only burning sensation in the chest or the precordial area, or we can say in the epigastrium, and in the risk area, or we can say high risk age of cardiac illness, then definitely we should think about the cardiac illness. We should go for advice immediately for ECG or other investigation. So these kind of many features are there described in Ayurveda, and it is our wisdom how we compare them with the modern medicine, or we limit to the Ayurvedic medicine. Many are comparable, many are not. Then in Kaphas Hriday Rog, feature is heaviness in the body, or Gauratvam, heaviness. Heaviness sometimes it present in the cardiac failures. We see in the right ventricle failure, we see the left ventricle failure, even in the congestive heart failure. Patient is having the swelling or sore. We see the edema, pedal edema. Pedal edema is a very important feature of cardiac failures. So that kind of features can be correlated, can be taken for the diagnosis or the management, or even the assessment of the drug or the research. In case of Tridosas, as usual, it can be presented with a mixed type of features. Then the thing comes to the Krami's type. Krami. Why Krami? What kind of Krami? Why it is described in Hriday Rog, Krami's type of Hriday Rog. So again, it is our wisdom. What we can compare them, how we can compare them. Krami, we know in Ayurveda described, some are the Sukshma Krami, means microscopic. Some are the Sthul Krami, maybe macroscopic, that can be visualized by the eyes. So many times the bacteria or the viruses, we are studying them under the heading of Bhut Vidya, sometimes in Ayurveda, and even sometimes we study them under the heading of Sukshma Krami, means microscopic Krami. They are a kind of living things. They are microscopic, cannot be visualized by the eyes, and they are causing many illnesses, many diseases in the mankind. So that kind of bacteria or virus can be taken. Here I am written the RSD, rheumatic heart disease. Streptococcus bacteria is the causative factors here. Subacute bacterial endocarditis, it is another infective disease of cardiac illness that can be taken under this category of Krami's Hriday Rog. And last, I have written the worm infestation. It is there written that a worm infestation in Ayurveda, we know, if we study the Krami Rog. In the Krami Rog, sometimes the Heradrav or Herad Rog is described as a feature. Krami, in the Prakran of Krami Rog, Heradrav or palpitation feature are described. Simultaneously, discoloration, or we can say Pandu or Vivannata is described there. Similarly, in case of modern medicine, when we see a patient of severe anemia, their hemoglobin is 3 gram or 4 gram. That may be due to any reason. Many times that anemia may be due to worm infestation. We know ascariasis or the hookworm infestation, many times they causes the severe anemia. Whenever we are examining the patient of severe anemia having the hemoglobin of 3 or 4 grams, we find on auscultation hemic murmurs. Murmur like feeling is there, murmur-like finding is there on the precaudal area when we examining. So many times it gets confused. We get confused with the patient is having cardiac illness. But in fact, the patient is not having cardiac illness, but murmur is there. Presentation is cardiac is there, but no cardiac illness is there. That murmur is due to severe anemia. That severe anemia may be due to worm infestation. So this is another path, another way by which we can correlate, we can think about that the severe worm infestation leading to severe anemia may cause Hridaya Rog-like presentation, and that can be kept under the category of Karmish Hridaya Rog. So these are our approaches by which we can study, we can tackle with the illnesses. Then if we compile the heart diseases described in modern medicine, although there are many categories are there, but the major are the 4 categories of the heart disease that are found very commonly in common man. First category is the ISD, we know, ischemic heart disease. There the improper blood supply is there to the cardiac area, the heart muscles, that causing the angina is a temporary illness, and the long term it can cause myocardial infarction. MI is there. Features, we know, the pain, sweating, palpitation, dyspnea, they can be the features. Another category is the VHD, we can say valvular heart disease. Then where the valves are affected, valve are diseased, that can be affected, it can be found in any valve like mitral, aortic, pulmonary, tricuspid. And the features are basically of 2 types, either it is stenosis or regurgitation. We know what happens in stenosis. Stenosis, the area of the aperture is get stenosed, it is narrowed, and the required amount of blood is not getting passed from one chamber to another chamber. It is the kind of, it is a stenosis. And what happens in regurgitation? Regurgitation, we know, every or between 2 chambers there is the proper valves, we know, and the work of valve is there to allow, to permit one direction flow, blood from one chamber to another chamber. If due to any disease or any issue, that valve is not closing properly, then what happened? The blood goes from one chamber to another chamber and it backflows there. So it is kind of regurgitation. Basically 2 types of lesions are there, maybe stenosis or regurgitation. And the cause behind it, sometimes it is congenital, sometimes, as I told, it may be a rheumatic heart disease. Features again, the dyspnea, palpitation, tachycardia, they can be common features. Although many features are there, but I have quoted here the common features. Then the other category comes the infective category. There the bacterial infections are most commonly there. Patient may present with a fever, dyspnea, chest pain, or even in the rheumatic, we know, the joint pain, severe joint pain, joint involvement is there. Then in some patients, we find some kinds of blocks, maybe partial heart block, maybe complete heart block. In the diagnosis, it is written as a left bundle branch block, right bundle branch block. These are the blocks between the SA node, AB node, Purkinje fiber, bundle office. We know the clear-cut anatomy and clear-cut physiology. Features maybe chest pain or sometimes bradycardia, because block is there. The heartbeat will be generated in the lesser amount, lesser rates, there will be bradycardia. And the cause behind it, many times it is due to ISD, ischemic heart disease, the many blocks are there. Then complications are always in each and every illness, each and every disease. If it is not being treated properly or timely, we can have the complications. So that can be found in the form of left ventricular hypertrophy, right ventricular hypertrophy, cor pulmonale, congestive heart failure. And the features of congestive heart failure, we know, very common: dyspnea, tachycardia, and edema, pedal edema, ascites, many gastropathies, they can be there. So it is very important to know all these things, because many times, many things which are not described in Ayurveda, but we have to treat on the contemporary basis. That contemporary basis means what our drugs can affect, can work at what level. at what pathology or what mechanism can be taken care by our Ayurvedic medicine. Because many Ayurvedic medicine, we say the herbal medicine, they are being scientifically trialed by many scientists, not only in India but abroad also, and they have shown, proved their typical role, typical their values, importance, that which feature of cardiac or heart it can be cured by them. So these are the measures in modern medicine. We know what they prefer in ISD. They are giving coronary dilators. So we should think about the coronary dilator, what we have in Ayurveda. They gave the antiplatelet drugs, anti-hyperlipidemics, beta blockers. Each and everything has the rationality, their importance. So similarly, in all the categories, they have specific approaches, specific drugs. So similarly, on that line, we have to think from our Ayurveda, from our Ayurveda knowledge, classics, that what kind of medicine drug we have. Although we think about the Vat, Pitta, Kapha, what dosas are there, which medicine can pacify the Vat, which can Pitta and Kapha. This is best idea, but many times it is not possible. So we have to think on the contemporary basis and go for the possible treatment. The common treatment, common measures are well known to everyone, that ahar visram, that should be given. Dietary, because the whatever the etiology is there, we have to focus on that etiology. Diet control is very important. Rest should be given. And in Ayurveda, we know Sansodhan Chikitsa, Sansaman Chikitsa. I have made the query regarding Sansodhan Chikitsa because at many places in the Hriday Rog it is contraindicated, because many times it creates excess very stress over the brain or the body. So it has to be avoided. But if it is necessary and the patient is suitable, it can be adopted, it can be given. Then in Ayurveda, a classic Charak Sutra, it is described how to we save the heart, avoid all mental grief. Psyche factor is very important. Ahar Vihar, what are the beneficial for heart? And Ojas, we know Hriday is the sthan of Ojas. So if we will care for Ojas, definitely we will care for the heart. So both are the very close things. So that should be taken care of. Ahar Vihar, making healthy srotas should be used. Srotas, what? All srotas are important, but in case of Hriday Rog, Hriday, Rasvaya srotas and Raktavaya srotas are more important. That should be made healthy with all measures. Then the pacification of whatever etiology is there or whatever dosas are there, that should be specified. If we think on the classical knowledge regarding the drugs which are used, which are mentioned to treat the Hriday Rog, typically these are very common. Many of us we know these are written like Pippali, Ela, Vacha, Hingu. Hingu, no, it is very good Vatanuloman. And I said that ISD, ischemic heart disease, is a Vatic type of Hriday Rog. So if in that case we do the Vatanuloman or Vatasaman, it can be very effective to the ischemic heart disease. Then other things are written. I have made the red color for the Rasna, that is Pluchia lanceolata and Inula racemosa, Pushkar Mool. These are the things are proved to be very effective in Hriday Rog. Rasna, we know the best Vat Samanam. So if we specify the Vat in any way, definitely it will be providing, it provides the relief in the case of ischemic heart disease, basically in the feature of pain and palpitation, dyspnea, etc. Then the Pushkar Mool. Pushkar Mool, it is described in Ayurveda as Parshul Haranam, and that Parshul may be sometimes due to pulmonary etiology or maybe sometimes due to cardiac etiology. It is very effective, and scientifically it is proved that it works as coronary vasodilator. So we give it, we advise the Pushkar Mool in different forms, maybe powder, maybe decoction or other preparations. These are the drugs described for the Vatic type. These are some preparations, because in Vat Vyadhi, in Ayurveda, Vat Vyadhi oil, ghrith, we can say Snehan, maybe internal Snehan or maybe external Snehan. It is very effective and it is prescribed, advised everywhere. So these oils are written, they have to be applied locally on the chest area. Maybe whatever oil is available, we can apply them. And maybe it is effective, locally effective. Some fraction of this oil maybe get absorbed and reaching the internal tissues and may provide relief. Then again, I highlighted the Pushkar Muladi Ghrat or Kal because it is made of Pushkar Mul. Pushkar Mul is proved role in the cardiac illness. It has to be given. Pushkar Muladi Kwath may be given in the form of decoction. And Dadim, Anar, we know. Anar is written to be very good Hridya drug, very effective in cardiac illness. So it can be given in different forms. Then Pathic type of Hridya Rog, you know, it is the more pith is there, more warmth, hotness is there. So cold therapy is always advisable, or as a classical therapy in case of Pittas Vyadhi, Virichan is described, it is indicated, can be given. Even cardiac illness also, the Mridu Virichan can be given. Then some drugs like the grapes, angur, sugar candy, some classical drugs are there, Yashtva, Vikadi, Kalp, Draksha Ghrat, Sthiradi Ghrat, Kakulyadi Ghrat. The Ghrat, you know, it is also pith pacifying drugs. They can be advised. Then for Kafats, Sweden, Woman, Langhan, these are the classical things. They can be adopted, they can be advised. Then other things, classical things are described here that which I am not going to detail. Tridosas, initially Langhan, and the one important preparation is written as Sur Darwadi Chum. It is described for Tridosas type of Hridya Rog, and other measures can be taken depending on the involvement of dosas. Kramis for Kraminashak treatment, that can be Ayurvedic, or from the modern medicine, we can go for the antibacterial or antibiotic drugs. Then we come to the important segment that contemporary knowledge, through the contemporary knowledge, scientific studies, what we can prescribe, and actually what I better to say that what we are prescribing, what we are giving. Whatever things are I have written here, these are practically being administered. Successful results are there. Patients are getting relief, and many of them are easily available in market, so that we can prescribe advice to the patient. They can take these things. If we think about the ischemic heart disease, I said coronary dilators are the prime importance. So beside other things, the Pushkar Mul is proved coronary vasodilator. It is given. We are giving frequently and successfully. It is given. Then risk factor in the IHD, the hyperlipidemia, or we can say dyslipidemia is there. For those, we have the proved drug like the Arjun, Rason, Vacha, Amlevetas, Brakchaml, and Gugulu. All these have the proved role of the anti-hyperlipidemic action, or we can say anti-dyslipidemic action. Many of them have the good effect in obese person. Obesity is getting reduced by them. So they can be given in a combination form or in the single form in case of hyperlipidemia, or we say dyslipidemia. Then many times we think about the cardiac tonics. Patient, we all know that in myocardial infarction, what happened there, it is the rule. We know that due to poor blood supply, poor coronary blood supply, some part of myocardium or heart muscle get died. Infarction means death. Complete death is there of that particular myocardium of that person, and that dead myocardium, that dead part of myocardium, that never gets revived. Whatever quantum of medicine, Ayurvedic medicine, allopathic medicine we are giving, coronary dilator we are giving, but that part never revives. Why we are giving the coronary dilators from Ayurveda or modern medicine? Just we are giving because to save the healthy area or the healthy myocardium of heart, so that the person can live longer with that segment of that fraction of myocardium which is healthy. We are just preserving them, we are saving them. Sometimes due to that, what happens? Major part of myocardium is getting diseased, getting infarction, and the heart performance is poor. Patient is having poor cardiac output. In 2D echo, what we are getting? LVEF, left ventricular ejection fraction. It is 65 to 70% is normal. If it written in the 65-70% LVEF in 2D echo, it is normal. But when the major part of myocardium is getting get infarct, it is getting weak, then when the cardiac output is not proper, the LVEF is coming to the 40%, 50%. In that time, that situation, we need some cardiac tonic that can provide the we say strength to the heart, power to the myocardium, so that the performance can be better. For those things, these are the drugs. These are having the proved role, like the pan, we know, and Dadam, Rose, Arjun, Karpur. Then some sea animals or sea products like Corallium rubrum, Praval. We are prescribing Praval in the form of Praval Pishti or Praval Bhasma. Gemstone, Mukta Pishti, basically. Mukta Pushti here means Mukta Mool Pishti, not the Mukta Shukti Pishti. Mukta Shukti Pishti is not much effective. In heart disease, we have to give the Mukta Mool Pishti. Then Jaharmora stone, Jaharmora Pishti is very effective in heart disease. And Akik Pishti. All these things have the proved roles. Some are the herbal, some are the mineral, or some are the from marine source. So that can be used, applied wherever the cardiac performance is not proper, cardiac output is poor, LVEF is lower. So it kind of approach we are making, we are administering. Then in case of valvular disease, heart failures, the symptoms, the features I have already said. There may be stenosis, there may be regurgitation. Due to that, there are the overload. Overload may be inside the heart or overload may be outside the heart. So for that, in modern medicine, these are the approaches. We are also making these approaches. Diuretics sometimes we require to reduce the overload. Either maybe basically when preload is there, just to reduce preload, diuretics having the good effect. For that, we have the proved diuretics, Punarnava and Gokchur. They are proved diuretic, and if we compare the performance or the work power, Punarnava is the mild diuretic and Gokchur is strong diuretic. But one advantage is in the Punarnava that it is having the high content of potassium. So in the modern medicine, sometimes in Ayurveda, when we are giving prolonged and heavy diuretics, patient goes into the hypokalemia because lot of potassium and sodium loss is there with the urination. But if we are giving the Punarnava, it has a high sodium potassium contents. So these patients will never suffer from the hypokalemia. But contrary to this, we have to check the patient's potassium sodium level. If any patient, because many patients of cardiac illness, later on they get having the issue with the kidney. So when kidney issue is there, patient having the hyperkalemia, high potassium is there. So if patient is of cardiac illness or maybe another patient, he or she having the hyperkalemia, high potassium is there, we should not prescribe the Punarnava. So it is the contemporary knowledge. We have the evidence, evidence we have in the laboratory parameters. So we should search them and adopt our therapy effectively and safely. Then coffee, it is having good cardiac stimulant action. It is good and diuretic also. So it has to be applied, used rationally wherever it is required. Then other things I have written here, that Carvir or Caner. We know in the congestive heart failure in modern medicine, what they are using? They are using the digitalis, digitoxin or digoxin. The drug is available in market with the name of lanoxin. It is given at 0.25 in the dosing. The Carvir or Caner, although digitalis is herb, but it is, we can say, hijacked by someone else. But Carvir is with us, Caner is with us, and we have tried it scientifically. It has similar action with the as digitalis or digoxin. So this Carvir can be given in the form of Bhasma or Carvir Yog to treat the patient of congestive heart failure basically. Because in CHF, congestive heart failure, the Carvir, it reduces the heart rate, means tachycardia is relieved, dyspnea is relieved, pulmonary edema is relieved, and sometimes it is working as cardiac tonic also. So it has multiple actions, and it is successfully we are giving in the patients of heart failure in the form of bhasma or the Karvir Yog. It is the name of preparation, it is available. Then Sarpagandha, we know Sarpagandha is very good antihypertensive. It is a good hypnotic or tranquilizers. It can be given wherever it is indicated. Then Rudraksh, many people are wearing the garlands of the Rudraksh, the form of mala, and even in Ayurveda, its Rudraksh churn or its bhasma is indicated to treat the heart disease or we can say hypertension. So it can be used or it is being used. You know, by wearing the garland mala, it is working by through the it's a prabhav action. You know, in Ayurveda, ras gun vipak are the mode of action, but prabhav is another thing. So Rudraksh is a best example which is working through the prabhav action of it. Then Abrak Bhasm is very good Hriday drug. Mrag Strang Bhasm, it is very effective in cardiac illness because both are useful for cardiac and side by side they are good for breathing troubles also. So in the patients of heart failures, congestive heart failures, they have the dyspnea or we can say dyspnea on exertion. So to treat them, the Abrak Bhasm or Mrag Strang Bhasm, they are very effective in those cases having the CHF. Then other drugs or other measures, as we know the etiology of cardiac heart disease, or IHD, even for each and every disease, anxiety, stress, they are the causative factors, important factors to cause them. So treating them, just to treat them, we should think about our Ayurveda. And in Ayurveda, many drugs are available as a Medhya Rasayan, Medhya drug, Nidra Janan, and a Nidra Shaman in many ways. So that has to be, I say, used rationally, not empirically. Everything patient comes to us, we give a syrup or tablet having all these things. Brahmi, Jatamansi, Sankushpi, everything is there. So it is not never rational. Because every drug has its different action. Some are having the brain stimulants, some are having anxiolytic action, some are having hypnotic tranquilizing actions. So that should be treated rationally, which kind of action is required in which patient. According to that, that drug should be given. You know, Jatamansi, tranquilizer, it is for need, and the Sarpagandha, it is also. Tagar is also, but all are having the different features, their different potency, where should be used in case of heart disease, and some of them may have side effect also. We say Sarpagandha, you know, Sarpagandha, we get from modern medicine, modern people gets the drug reserpine from the Sarpagandha. The reserpine, sometimes it is having the bronchospasm activity. So the patient, any patient which is having already asthmatic problem, dyspnea problem, in that case, the Sarpagandha better not to use for any indication, either for hypertension or for this Nidra Janan, or we can say tranquilizing effect. Because it may cause side effect, it may cause bronchospasm. So that patient of dyspnea or breathing trouble may get worsened. So this kind of rational therapy should be adopted. Common preparation, these are the available in market. Arjunarist, Rason Pak, Hridayarnav Ras, Prabhakar Ras, Nagarjunav Ras, Srangrav Ras. So the drugs or the preparation I have mentioned in green color, these are the things which are freely available in market and we are using them in frequently and successfully. The black one, they are described in text. Maybe in some other states they are available, but they are not under my knowledge that it is available here or there. But wherever they are available, they can be used. And many things that people know about many drugs, many preparations, but sometimes their lack of knowledge, we can say, or incomplete knowledge is there. Many patients come to us, they say, we are taking the Arjun Kheer Pak, we are taking the Arjun ko hum log dudh paka ke peete rehte hain. We are taking for the years, for months, many times. But they don't know the exact method, how to prepare them, how to make that Arjun Kheer Pak. So it is our duty to educate them that how we should prepare the proper Arjun Kheer Pak so that it can be effective, more effective to your heart disease. We know the ratio is there, 1:32. The bark, chal, milk and water process is there. and they have to boil, and the optimum or the whatever amount of milk was added, that has to be remnant, and that will be taken for better relief. So this kind of many myths are there. We can say mismatching are there in the practice patients, and they are not getting proper relief, and sometimes defaming our Ayurveda. So it is our duty to educate them. Then other drugs, like I said, Mukta Pishti, Raval Pishti, Akik Pishti, Jharmara Pishti, these are freely available in market and can be given very safely. We are giving them very safely. Then I told about the Karvir. The Karvir Yoga, it is very effective for congestive heart failure patients. Pushkar Brahmi Gugul, it is not a classical preparation. It is the Anubhuti Yoga from the Banaras University. It was made here and very effective for, we say, in the patients of angina, myocardial infarction, even hypertension, in case of hyperlipidemia, or we can say anxiety-induced cardiac illness, or we say anxiety-induced hypertension. This Pushkar Brahmi Gugul, it is very effective. Sarpagandha Churn or Ghanbati, it is given frequently, but should be given with precautions. As for diuretics are concerned, Gochuradi Gugul, Nanava Mandur, they are being practiced very safely. Ashwagandha, Ashwagandha, master drug, it is having the many multiple actions. It is Vatsamak, it is anxiolytic, it is a Hridaya drug, we can say, it is a Vranghan, many actions are there, so that should be used accordingly. Then this is the yoga described in one Ayurvedic book, classical book, as Jawahar Mohra Yoga. So it contains very important things. We say Jharmara Pishti, Panna Pishti, Mukta Pishti, Praval Pishti, Ghaira Pishti. So, and it is very effectively described to treat the patients we are very having in the serious illness of cardiac illness. Maybe they are going to die due to MI, and it is very effective. But some contents of there are, I think, not available nowadays, like Kasturi, Ambar. Sometimes it is not available. But if it is available, it can work very effectively in the cases of serious, or we can say terminal stage of cardiac illness patients which are going to die with the ischemic heart disease or myocardial infarction. So it is described there. Just for information, I am putting here. It is known as Jawahar Mohra Yoga. Then some other preparations available in market. Their chief contents or indications I quoted here. Contents are important because as a Vaidya, as Ayurvedic doctors, we should always know the contents, or we should say chief contents of the any Ayurvedic yoga, what they are having. Based on that particular contents, we can make newer indications, or we can frame some contraindications for any particular Ayurvedic yoga. So these are the common drugs we are using. I have written here Dana Ras, Bhratva Chintamani Ras, Yugandhara Ras, Chintamani Ras, Nagarjunabhra Ras. There many people, things are known by name, like in Nagarjunabhra, it contains Arjun. So, and other drugs are there that I mentioned here. And the possible indications, or the, we can say, best indications are there. I have written in the rightmost column. Then something comes from the classics. Something has to be discussed or thought about, like the Hridaya drug are described. So these are some, many times they are the subject of discussion, subject of debate. Why they are Hridaya? Why they have described the Hridaya drug? But Hridaya, many Hridaya, they are not described in case of Hridaya Rog treatment, but they have written Hridaya. Why Hridaya? Maybe beneficial for heart in many ways. But if we see, we analyze them, their characteristics, features, their scientific studies, then we find that many of them having the anti-hyperlipidemic or anti-obesity action, anti-dyslipidemic action. If that kind of weight is reduced, if dyslipidemia is being cured, treated, then patient can be saved from the heart disease. Or if any patient are having already have the heart disease along with obesity, overweight, if by means we reduce their heart overweight or weight, patient will getting benefit. So that Hridaya Aushadhi can be useful. Definitely they are having some, they make the green Vriksham and Amlevitas. These are the two drugs that we have tried personally in case of patient of hyperlipidemia, and they are effective. Others are being tried. Scientific studies are going on, and very soon it will be coming to us so that we can say that not directly, but indirectly, they are healthy drug. They are beneficial to the heart, or we say heart disease. Then another category is described Lekhani Mahakasaya. 10 things are there. Why Lekhan? What Lekhan? Lekhan again. Lekhan is the something scrapping, something removing the extra things or excess material from body or from any part. So the Lekhan drug again, they can be effective and to reduce the weight or the lipids, dislipids, and although other actions are there that I'm not going to detail, but definitely they are effective in heart disease. And it is our duty, it's our wisdom that how we prove them scientifically in favor of heart disease and how we imply in the clinical practice. Then some individual drugs that I am giving in the very short, because the studies, scientific studies are already performed. Arjun, we know their action is anti-hyperlipidemic and normotensive. Normo means why written. Sometimes it is given in hypotension, sometimes it is given in hypertension. But we should go for the proper monitoring and we find the result of normotension. Patient's blood pressure is normal. And scientific action as required, it is positive inotropic, means it promotes cardiac output or it increases cardiac output. It improves ejection fraction. Then another action, negative chronotropic, means it increases heart rate. It increases heart rate, means sometimes patient having the tachycardia.
Sir, time actually 1 hour is over.
Okay, sir. Okay, and I'm going very short. So it
Right,
reduces.
three speakers are there.
Yes, sir. It increases heart rate and increases cardiac contractility. So it is they are used. And the preparation we know, Karvir I already told, it is very effective in congestive heart failure. Pushkarmol, it is coronary dilator. Camphor Kapoor, it is good Hriday drug. Tambul, I told Hriday drug. Rose Gulab Gulkand we are using, it is good for heart disease. Rudraksh, I told it is for hypertension. Sarpgandha has hypertension and tranquilizing effect. Gugul, it is proved, scientifically proved, anti-hyperlipidemic, antithrombotic. Garlic, Rason, Lason, it is very good for lipids. And Praval, Mukta, coffee, the diuretics drugs are there. Anxiolytics, Ashwagandha, Tagar, Jatamansi, Brahmi, Sankushpi, all are having the effective actions and the good things that has to be used rationally, not empirically. It is my humble advice too. And very important thing is that if the patient coming to us from the heart in acute stage or whatever stage, we should assess, we should estimate ourselves. We should know our limits, that whether we should treat this patient or not. If patient is more serious, we have to refer to a higher center or modern medicine or ICU, CCU. If it is in chronic stage, we can cure them, control them, then we have to treat. So with these things, I thank the organizers, especially Pawan Sharma and my teacher, Mithil Sarji, V. Sharma and many others. Thanks for your patience audience. Thank you.
Thank you, Dr. Rajendra Prasad. You have covered everything, really excellent. Excellent, Dr. Rajan, excellent. Agnihotri, sir, your valuable comments.
Sir, thank you so much. As per our expectations and our beyond our expectations, at both the condition, Dr. Rajendra Prasad really unfold his umbrella to the broadest spectrum. And we have heard this preparation here in Rishikul also 2 or 3 years back when he was presenting the same manner, but that was eye-to-eye contact. Here again, it was just revision to us, but most beneficial to all of our learned speaker, listeners, and in archive also it will be a remark history for us all. Since we have got our 3 more speakers and they are all full-fledged, so without wasting any second, any minute, we would like to call them in a sequential manner. So over to Pawan Sharma ji. Most greetings and congratulations to Dr. Rajendra Prasad ji. Thank you. Keep it up. Thank you, Beta. Thank you.
Thank you. Thank you, sir. Thank you very much. Now I would like to request Dr. Dhaivat Vora, my classmate of IPGT and RA in 1989, 1986 to 89. Dr. Dhaivat ji, welcome. Welcome.
Namaskar, Pawan ji.
Pranam ji.
Pranam,
Professor and head of the department in Parul University. Welcome.
इंडिपेंडेंट रिसर्च एंड एथिक्स सोसाइटी के माध्यम से हम सबको आप जोड़ रहे हैं, तो पहले आपका धन्यवाद कर लेते हैं। अग्निहोत्री सर जी के भी आशीर्वाद मिल रहे हैं और सब स्पीकर्स के साथ जुड़ने का, राजेंद्र प्रसाद जी का भी वक्तव्य का लाभ मिला, तो सबका धन्यवाद ज्ञापन करता हूं। अभी मैं स्वस्थ वृत्त से हूं, तो मैं प्रिवेंशन के बारे में प्रिपेयर किया हूं और वो मैं मेरी स्लाइड शेयर से आपको दिखाऊंगा। प्रिवेंशन ऑफ हार्ट डिजीजेस थ्रू आयुर्वेदा। मेरे स्लाइड्स दिख रहे हैं पवन जी?
हाँ जी
जी।
मोबाइल से भी आप फुल स्क्रीन कर सकते हैं, वो तरीका मुझे नहीं मालूम है।
हाँ,
मोबाइल से भी फुल स्क्रीन
कर देते हैं। हाँ, फुल स्क्रीन कर देते हैं जी। In India, 3 crore people die every year due to heart disease. In Western world, people of young age group affected by heart disease is increasing. Coronary heart disease is our modern epidemic which affects large population. Prevention is possible. Coronary heart disease is preventable. Etiology of coronary heart disease is multifactorial. So the approach for prevention also should be multifactorial. Individuals at special risk are those who smoke, chew tobacco, those with a strong family history of coronary heart disease, diabetes and obesity, and young women using oral contraceptives. Secondary prevention, the aim is to prevent the reoccurrence and progression of coronary heart disease. In general, we say it hurry, worry and curry. These are the 3 major factors. Hurry means anxiety, worry means stress, and curry means food items containing fat. So these 3 should be avoided. Now, Ayurveda approach for the heart disease mentioned by Charak is Radyam Syat Yad Aujasyam Srotasam Yat Prasadanam Tat Tat Sevyam Prayatnena प्रशमो ज्ञानमेवच। जो ओज को बढ़ाने वाली चीजें हैं, जिसको हम इम्यूनिटी बढ़ाने के लिए भी यूज करते हैं, ये सब चीजें रद्य हैं। स्रोतस को जो प्रसादन करती है, ये सभी चीजें रद्य हैं। दधि वगैरह अभिसंधि है, स्रोतस में गुरुता करते हैं, तो ये कॉन्ट्राइंडिकेटेड है। जबकि स्रोतस को प्रसादन करने वाली चीजें ही आहार में उपयोग करनी चाहिए। प्रशम और ज्ञान। प्रशम का मतलब है रिलैक्सेशन, शांति, और ज्ञान का मतलब है आत्मादि का ज्ञान, जो कि सत्वावजय से रिलेटेड है। मनोनिग्रह, कल जो हमारा इस प्लेटफॉर्म पर से लेक्चर हुआ, इसमें साइकी और मन के बारे में बहुत सारा डिस्कशन अच्छे से हुआ। तो आत्मादि का ज्ञान, द्विधृति स्मृति का ज्ञान, ये सब चीजें हृदय रोग में काम एंड कूल प्रशम के लिए आवश्यक है। ये चरक का दृष्टिकोण है हृदय के बारे में। भाव प्रकाश जी ने दिनचर्या के प्रारंभ में बताया, ब्राह्मे मुहूर्ते उत्तिष्ठेत तत्र दुःखस्य शांत्यर्थम स्मरेद ही मधुसूदनम। पहला स्टेप, आपकी आंख खुली, आपको थैंक्स गिविंग करना है लॉर्ड को। Prayer is the most important first step after awakening in the morning. हम उसको त्रिकाल संध्या दिन में 3 बार करते हैं। कार्डियक पेशेंट्स को एगनी रहता है, मुझे हार्ट डिजीज हो गया है, मेरा कुछ हो जाएगा। तुम्हारे से ऊपर कोई है जो तुम्हारी रक्षा करने वाला है। ये कॉन्फिडेंस हमें प्रेयर से मिलता है, इसका बहुत इंपॉर्टेंस है। The next step is Ushah Jalpan. One should take plain lukewarm water. Start with 1 glass, increase up to 3 glasses, and keep water in copper vessel overnight if possible. This gives very good effect. भाव प्रकाश जी ने जलपान, उषह जलपान के बारे में डिजीज का लिस्ट किया। मोर देन 20 डिजीज कैन बी क्योर्ड विथ उषह जलपान। तो हृदय रोग के लिए बहुत फायदा कारक है, रसायन भी है। उठने के बाद उषह जलपान के बाद चाय पिएंगे तो उसमें ग्रीन टी, ये हृदय माना गया है, उसका यूज करना है। सिनामोम, कार्डामोम, क्लोव, अर्जुन त्वक, ब्राह्मी, ये सब चीजों से बनी हुई चाय प्रज्ञापेय नाम से उपलब्ध है। ऐसी चाय बना करके लेना कार्डियक पेशेंट्स के लिए बेनिफिशियल है। शौच विधि, कार्डियक पेशेंट्स को रेगुलर कॉन्स्टिपेशन देखने को मिलता है, उसको कम करने के लिए हमें मेडिकेटेड कैस्टर ऑयल 1 टीस्पून मॉर्निंग में लेना है, आइडियली विथ ल्यूकवार्म वाटर और चाय में डालकर, और इवनिंग में इफ क्रॉनिक कॉन्स्टिपेशन है आप 2 बार ले सकते हैं। आप सॉक्ड ब्लैक करंट 11 पीस लेना है, ओवरनाइट सॉक करके सुबह उठकर पीना है, दाने चबा के खाना है। आप आवश्यकता होने पर ये 2 बार भी कर सकते हैं। इट एंश्योर्स बॉवेल क्लियरेंस। कार्डियक पेशेंट्स में कॉन्स्टिपेशन, द स्टूल शुड पास विदाउट प्रेशर, ये चीज अब बहुत आवश्यक है और ये हम इससे एंश्योर कर सकते हैं। ब्रेकफास्ट में हमें दलिया विद काउज मीट लेना है, ओवरनाइट सॉक्ड ड्राई फ्रूट्स लेना है, ये फोटो में दिखाया है। रात को पानी में भिगोना है 2 पीस ड्राई फ्रूट्स, सुबह वो पानी निकाल देना है और फिर चबा करके ये फ्रूट्स को हम ले सकते हैं। इडली विद सांभर, पोहा, उपमा, खाखरा कैन बी गुड ब्रेकफास्ट फॉर कार्डियक पेशेंट्स। डाइट में हमें कुछ सिलेक्ट करना है, तो ये नित्य प्रयोजित आहार जो बताया गया है उसको आधार करेंगे। नित्य प्रयोजित आहार एग्जैक्टली मैचेस विद द बैलेंस्ड डाइट ऑफ मॉडर्न कॉन्सेप्ट। तो ये नित्य प्रयोजित आहार में यव गोधूम का रोटी बनाएंगे, हम मूंग लेंगे, फ्रूट्स में पोमेग्रेनेट, पपाया, ये सब ले सकते हैं, और ड्राई फ्रूट्स में आलमंड वगैरह ले सकते हैं। The milk and ghee should be strictly cow's milk and cow's ghee containing less fat. ये पोमेग्रेनेट है, वो बताया कि अम्लोरद्यानम, अम्लरस रद्य है। ये दाडिम नित्य प्रयोजित में भी है और त्रिदोष शामक भी है। According to modern, it contains lycopene, which is a very strong potent antioxidant. So हम नित्य प्रयोजित आहार लेंगे, ये त्रिदोष शामक रहेगा, रसायन भी रहेगा। विटामिन सी नाम से जितने भी चीजें हैं उसमें दाडिम और आमलक के सिवा वो त्रिदोष शामक नहीं रहती। तो हमारा ये सिद्धांत हमें फॉलो करना है, ज्यादा बेनिफिशियल है। डाइट का सिलेक्शन के बाद उसका जब प्रिपरेशन की बात है, हमें आटा है रोटी बनाने का, वो खुरदरा होना है। गेहूं का, यव का आटा, खुरदरा आटा से रोटी बनानी है। और जब हम तड़का लगाएंगे उसमें काउज घी यूज करेंगे, उसमें हल्दी, धनिया, जीरा, हींग, मेथी, अजमा डाल सकते हैं। फ्रेश ग्रीन अदरक, कोरिएंडर लीव्स, करी लीव्स, पुदीना डाल सकते हैं, सेंगडो यूज करेंगे हम। और ये डाइट हमें प्रिपेयर करके अच्छे से लेना है। अभी हम खाना खाने बैठते हैं तो पहले सोच लेना है कि हमारा स्टमक है वो कैन बी डिवाइडेड इन 3 पार्ट्स। 1/3 should be solid, 1/3 should be liquid, and 3rd part should be kept vacant. This helps proper digestion of food. खाना खाने के बाद पेट फूलना, डका रहना, हैवीनेस, ये नहीं होना है। कार्डियक प्रेशर नहीं बढ़ना चाहिए, तो हमें 1 रोटी कम खाना है। त्रिविध कुक्षी प्रिंसिपल में ये हमें बताया गया है शास्त्र में। देन डायटरी रूल्स है, वो हमें फॉलो करने हैं। वी विल स्टार्ट विथ प्रेयर। ब्रह्मार्पणम ब्रह्महवि अहम वैश्वानरो भूत्वा। तो ये डाइट प्रेयर के साथ शुरू होना है। अग्निहोत्री जी के नाम से याद आ गया, हम खाने के टाइम में यज्ञ का भी विधान। तो ये एयर फ्रेशनर है, वातावरण को पवित्र करता है और एंटी माइक्रोबियल, फूड को लगने वाले फंगस वगैरह से हमको एंश्योर करता है, उससे बचाता है। ये हमें करना है। तो अग्निहोत्र यज्ञ भी करना है। भोजनाग्रे सदापथ्यम लवण आर्द्रक भक्षणम, आर्द्रक और लवण का लेना है। भोजन चल के टाइम मोबाइल टीवी का यूज नहीं करना है। अजलपन आहसन तन्मना भुंजित करना है। द फूड शुड एंड विथ मुखवास, उसके लिए नागवल्ली, बेटल लीफ, अजमुदा, एला, मिश्रया, फ्लैक्सीड का उपयोग हम कर सकते हैं। अपथ्य आहार, डाइट टू बी अवॉइडेड, नॉन वेजिटेरियन, ऑयली फूड, डेयरी प्रोडक्ट्स, चीज वगैरह, मैदा, सलाद नहीं लेना, में सूप बना करके उसको लेना है। रॉ वेजिटेबल से डकारे आना उत्क्लेश होता है। फ्रोजन फूड्स, जंक फूड, स्पाइसी फूड्स, ये सब नहीं लेना है। गार्लिक और जिंजर, इसके बारे में हमें थोड़ा जानना है। गार्लिक इज वेरी इंपॉर्टेंट, ब्लड थिनर के लिए बेस्ट है। प्रॉब्लम यह है कि हमारा एस्पिरिन भी चल रहा है, क्लोपिडेग्रोल टाइप मेडिसिन चल रहे हैं, हम गार्लिक भी ले रहे हैं, उसकी वजह से गर्म इलाकों में जहां टेम्परेचर 44 डिग्री रहता है, तो ऐसे इलाकों में ये सभी चीजें, ब्लड थिनर भी चल रहा है, गार्लिक भी चल रहा है, ब्लीडिंग डिसऑर्डर्स देखने को मिलते हैं। ब्लड फाइल्स, ब्लीडिंग फ्रॉम गम्स, ये सब देखने को मिलता है। तो उसको हमें प्रिवेंट करना है। हम पेशेंट को बोलते हैं गार्लिक इज इनफ, आप ब्लड थिनर नहीं लेंगे चलेगा। यदि आप ब्लड थिनर भी ले रहे हैं तो आप गार्लिक को कम करें। आप जिंजर पर आ जाइए। अदरक बहुत पोटेंट हृदय के स्रोतस को शुद्ध करने में काम करता है, और आर्द्रक स्वरस हम चाय में, दाल में या शहद के साथ ले सकते हैं। इट इज द बेस्ट कार्डियो प्रोटेक्टिव ड्रग। एंजाइम्स डाइजेशन को एंश्योर करता है। डाइट में ये सब चीजों के ध्यान रखने के बाद हम एक्सरसाइज पर आएंगे, व्यायाम पर आएंगे। साइकिलिंग, जॉगिंग, स्विमिंग, बहुत सारे एक्सरसाइजेज हैं, एरोबिक्स, जिम, जैसे कि पहले लेक्चर्स में राजेंद्र प्रसाद जी ने भी अच्छे से बताया। जिम्स में प्रॉपर ट्रेनिंग नहीं होने से ज्यादा नुकसान होने की संभावना है, हम वो नहीं करेंगे। सभी व्यायाम बॉडी को स्ट्रेच के लिए है, लेकिन बॉडी को स्ट्रेच और रिलैक्स दोनों चीजों को एंश्योर करने वाली चीज है योगासन। सो योगासन इज द बेस्ट कार्डियक एक्सरसाइजेज, और उसमें हम ताड़ासन, वज्रासन, पवन मुक्तासन, भुजंगासन, शवासन, उष्ट्रासन और सर्वांगासन को सिलेक्ट करेंगे। ऐसे आसन जो कि हार्ट के ऊपर प्रेशर ना बढ़ाए, उसका हमें यहाँ ध्यान रखना होगा। और योगासन करने से जो बेनिफिट्स है, उसके बेस्ट एग्जांपल्स हमारे प्राइम मिनिस्टर जी हैं। वो डेली योगा करते हैं और बहुत फिट रहते हैं, तो उनसे भी हमें प्रेरणा लेनी है। योगासन को परफॉर्म करना इजी है। ताड़ासन, उष्ट्रासन यहाँ बताया गया है। ये हमारे इंस्टीट्यूट का योगा हॉल है और हमारे स्टूडेंट्स योगा कर रहे हैं। मुझे सौभाग्य मिला है स्वस्थ विभाग में मेरे सभी बैच के सभी स्टूडेंट्स परफेक्टली सभी योगासन सिलेबस में वो करते हैं। उनको वो परफेक्टली करना है, उनका फोटो भी जर्नल में करते हुए लगाना है। तो ये बच्चे अच्छे से योगासन और प्राणायाम, नेति दौती वगैरह कर लेते हैं। दिट इज ऑल्सो वेरी बेनिफिशियल फॉर कार्डियक पेशेंट्स। ये बच्चे तो कर लेते हैं। जब योगासन पेशेंट्स को करवाना है तो पेशेंट्स को करवाने में थोड़ा डिफिकल्ट है। पेशेंट यदि वीक है, पेशेंट का इजेक्शन फ्रैक्शन लो है, पेशेंट को डिस्निया ऑन एक्सर्शन होता है, ऐसे पेशेंट्स ज्यादा योगासन परफॉर्म नहीं कर सकते। उनको हम पहले लर्निंग योगासना में डालेंगे। लर्निंग माने कि विथ सपोर्ट। ये पेशेंट ताड़ासन कर रहा है, वॉल के सपोर्ट से कर रहा है। पेशेंट के लेग्स के नीचे पिलो रखकर उसको सपोर्ट दिया गया है। उत्तान पादासन पोजीशन अचीव करवाया गया है। पेशेंट को चेस्ट के नीचे पिलोज देकर सपोर्ट किया गया है ताकि वो लंबी देर तक भुजंगासन में रह सके और उसके बेनिफिट्स वो ले सके। यहाँ पर पेशेंट को पवन मुक्तासन दिया गया है, जहां नेक मूवमेंट नहीं है। नेक मूवमेंट यदि पेशेंट कर सकता है तो ही उसको करना है। पेशेंट को जब हम योगासन करवाते हैं तो ये सब चीजें अवश्य ध्यान रखना चाहिए। उनको हम सपोर्ट के आधार पर लर्निंग योगासन करवाएंगे, वो उनके ज्यादा बेनिफिट्स रहेगा। और ग्रेजुअली वो ज्यादा करने के बाद रेगुलर योगासन विदाउट सपोर्ट भी कर सकेंगे। प्राणायाम्स में डीप ब्रीदिंग करना है। डीप ब्रीदिंग इट शुड बी स्लो एंड कॉन्शियस। आपको मैक्सिमम एयर इनहेल करना है, जबकि उस करने के बाद आप भ्रामरी प्राणायाम, ओम प्राणायाम करते हैं। डीप ब्रीदिंग करना है, एक्सेल करने के टाइम ओमकार का उच्चारण करना है। ये भ्रामरी प्राणायाम बेस्ट है हमारा मन के लिए। वो मन शांत करता है। एंजाइटी, डिप्रेशन, कार्डियक पेशेंट्स को बेस्ट है ये भ्रामरी प्राणायाम। अगेन सिंपल है तो उसका अभ्यास करना चाहिए। 21 बार ओमकार प्राणायाम करने से हमें काफी फायदा होता है। सुबह शाम दो टाइम खाली पेट हम ये कर सकते हैं। अनुलोम विलोम भी लेफ्ट एंड राइट, नासिका को ओपन करना है, बंद करना है, हम प्रयत्न करने से कर सकते हैं, बेनिफिशियल है। कपालभाति के लिए हम ज्यादा फेवरेबल नहीं है। पेशेंट्स प्रॉपरली करते नहीं है, चैनल में देखकर कपालभाति करते हैं। हम 200 करते हैं, 300 करते हैं, रेस लगाते हैं, उसकी वजह से डैमेजेस होते हैं, तकलीफें होती है। तो हमें ओनली अंडर एक्सपर्ट सुपरविजन ही कपालभाति वगैरह प्राणायाम करना है। ठीक से कर रहे हैं तो ही करना है, और 5-10 करने के बाद ही 500 कभी नहीं करना है। हमने 10 कपालभाति ठीक से कर लिए, दैट इज इनफ। वो भी नहीं करना है यदि एक्सपर्ट सुपरविजन नहीं। बट डीप ब्रीदिंग एंड भ्रामरी प्राणायाम मस्ट बी डन डेली ट्वाइस। आपको चेस्ट पेन, यू आर फीलिंग डिस्कम्फर्ट, उस टाइम भी आप डीप ब्रीदिंग कर सकते हैं। अपने इमीडिएट आपका बाईपास ऑपरेशन हो गया, 3 महीना हो गया, यू कैन स्टार्ट विथ डीप ब्रीदिंग, भ्रामरी प्राणायाम। रिलैक्सेशन बहुत इंपॉर्टेंट है। आहार, निद्रा, ब्रह्मचर्य त्रिविध उपस्तंभ है। हमें साउंड स्लीप एंश्योर करना है और उसके लिए शवासन का प्रयोग कर सकते हैं। शवासन पूरे बॉडी को रिलैक्सेशन के लिए है। शवासन करने के साथ हम कब नींद लग जाती है पता नहीं चलता। कॉन्शियसनेस के साथ जो शवासन किया जाता है उसको योग निद्रा बोलते हैं। वो भी बहुत बेनिफिशियल है कार्डियक पेशेंट्स के लिए। हमें ये इंश्योर करना है कि ड्यूरिंग स्लीप स्नोरिंग ना हो, मूवमेंट ना हो, ड्रीम्स ना हो। दिस सजेस्ट साउंड स्लीप नहीं है, तो हमें उसके लिए उपाय करने हैं। और इनएडिक्वेट स्लीप कॉजेज हार्ट अटैक इन यंग पीपल। जैसे कि राजेंद्र प्रसाद जी ने भी बताया, टारगेट दिया जाता है और टारगेट अचीव करने में दौड़े लगे रहते हैं यंग पीपल, विशेष रूप में अपने हेल्थ का ख्याल किए बिना पूरा नींद नहीं ले रहे हैं। नींद के दरमियान टिश्यूज रीजनरेट होते हैं, और ये लाभ नहीं मिलने से यंग पीपल में जो कार्डियक अटैक्स ज्यादा देखने मिल रहे हैं, उसका कारण यही है। इमोशंस को भी हमें कंट्रोल करना है। ये एंगर, ग्रीड, जेलस, एंजाइटी, वरी, इमोशंस साइकोसोमेटिक कार्डियक डिजीज ये एस्टैब्लिश हो चुका है। तो इमोशंस कंट्रोल से ही हम इसको प्रिवेंट कर सकते हैं। हमारे जो सत्वावजय चिकित्सा, सद्वृत्त नियम पालन, आचार रसायन, सभी उपाय इसमें बहुत उपयोगी हैं, वो हमें करने हैं। ये सब चीजें नहीं लेना है। टोबैको, अल्कोहल, कॉफी कॉन्स्टिपेशन करती है। बेवरेजेस, स्मोकिंग, डे स्लीप, सप्रेशन ऑफ अर्जेस। ये सप्रेशन ऑफ अर्जेस में भी वायु और पुरुष के वेग विदारण करने से उसका वायु का प्रतिलोम गति होने से डायरेक्ट हार्ट के ऊपर इफेक्ट आता है। ऐसा क्लियर कट रेफरेंस अष्टांग हृदय में दिया गया है। तो इस चीजों से हमें बचना है। कई सक्सेसफुल कार्डियोलॉजिस्ट की बात मैं करूंगा। डॉक्टर बिमल छाजेट जी थे, वो एम्स में कार्डियोथोरेसिक सर्जन थे। कार्डियक ऑपरेशंस करने के बाद पेशेंट में रिकरेंस देखने को मिला बहुत सारे केसों में। उन्होंने स्टडी किया, और उन्होंने ढूंढ निकाला कि ऑयल इज द कल्प्रिट। तो 0 ऑयल डाइट करके उन्होंने होलिस्टिक प्रोग्राम बनाया है। उन्होंने ऑपरेशंस कार्डियोथोरेसिक सर्जन्स है, अभी वो कार्डियोथोरेसिक फिजिशियन और ज्यादातर काउंसलिंग प्रोग्राम्स करते हैं और पेशेंट्स को ठीक करने के लिए बिना सर्जरी कौन से उपायों से किए जाते हैं, ये सब चीजें के ऊपर उनका ध्यान है। वो भी 0 ऑयल डाइट को प्रमोट करते हैं। हमारे यहाँ काउज घी और काउज मिल्क के सिवा कोई ज्यादा फैट आइटम्स हम एडवाइज नहीं करते हैं। दूसरे सक्सेसफुल कार्डियोलॉजिस्ट डॉक्टर सतीश गुप्ता जी हैं, जो कि ब्रह्मा कुमारी सेंटर्स आबू से जुड़े हैं। माइंड बॉडी मेडिसिन ऐसे कॉन्फ्रेंसेस वो डॉक्टर्स के लिए करते हैं। DRDO में जब अब्दुल कलाम जी थे तब उन्हें कार्डियोलॉजी को प्रिवेंट करने के लिए प्रोग्राम प्लान डिजाइन किया गया और उसमें डॉक्टर सतीश गुप्ता जी को काम करने का तक मिला। उसके बाद उन्होंने ये प्रोग्राम डेवलप किया है और सैकड़ों पेशेंट्स को उन्होंने ठीक किया है। उनका जो फोकस है वो मेडिटेशन के ऊपर है। मेडिटेशन से इमोशंस और साइकोसोमेटिक कंडीशंस को अच्छे से कंट्रोल किया जा सकता है, ऐसा उनका बहुत स्पष्ट रूप में से कहना है। अहमदाबाद के डॉक्टर रमेश कापड़िया जी का भी यूनिवर्सल हीलिंग प्रोग्राम्स है। ये सभी बहुत सारे NGOs और कार्डियोलॉजिस्ट ये काम कर रहे हैं कि हम मेडिटेशन, योगा, प्रॉपर डाइट से कार्डियो के पेशेंट्स को विदाउट सर्जरी अच्छे से ठीक कर सकते हैं। उनका ये सक्सेस स्टोरीज है। There were earlier surgeons doing operations. They stopped surgery and only by holistic approach they are treating patients successfully. ये बात भी हमें बहुत प्रेरणा देती है। पेशेंट्स को अब जल्दी में डाइट बता देंगे, योगा बता देंगे, नहीं हो सकता है। रिपीटेडली उसको काउंसलिंग करने पड़ते हैं। उसके लिए हम हमारी पारुल आयुर्वेदिक हॉस्पिटल के अंदर इवनिंग 4 to 5 हमारा पेशेंट काउंसलिंग सेशन रहता है। उसमें हम पेशेंट को डिफरेंट हेल्थ प्रोमोटिव आइटम्स, पथ्य, डाइट, योगा एक्सरसाइजेस के बारे में बताते हैं। तो यहाँ वो फोटो लिया गया है और हमारे पेशेंट काउंसलिंग का सेशन है ये। तो उसमें भी पेशेंट्स के डाउट बहुत सारे हैं, मिथ्स हैं, वो अच्छे से क्लियर होते हैं। ये कार्डियक डिजीज को हम रिवर्स कर रहे हैं, वो 2, 3, 4, 6 महीना, 1 साल, 2 साल तक चलने वाली प्रोसेस है। उसमें रिपीटेडली पेशेंट को मोटिवेट करने के साथ काउंसलिंग करना पड़ता है, तब हम जाकर के उसका बेस्ट रिजल्ट्स देखने को मिलता है। सो प्रिवेंशन थ्रू आयुर्वेदा, we have seen that major problems faced by patients in heart disease surgeries, they cannot be performed surgery because of heavy diabetes, old age, financial problems, intolerance to medicine. Patients उसको अल्सर वगैरह है तो वो एक टेबलेट भी एस्पिरिन टॉलरेट नहीं कर पा, उसको विटिलिगो है वो एक टेबलेट एस्पिरिन टॉलरेट नहीं कर पा। ऐसे पेशेंट्स भी आप सर्जरीज में नहीं कर सकते हैं, टॉलरेंस मेडिसिन को भी टॉलरेट नहीं कर सकते हैं। 20% केसेस में रीअकरेंस देखा गया है। एंजियोप्लास्टी बाईपास करने के बाद फिर से ये बीमारी होती है। तब ऐसी कई कंडीशंस में such patients can also follow Ayurvedic Swasthavavrtta principles, which assures prevention of heart diseases. So my message is, if you are a cardiac patient diagnosed, don't get panic. Start Ayurvedic medicine, follow Ayurvedic dietetics, yogasana, pranayam, following principles of Swasthavavrtta, Sadvritta, Achar, Rasayan, following ideal regular lifestyle, and with regular monitoring of your condition, heart disease can be prevented successfully. धन्यवाद। प्रिवेंशन के बारे में मैं कुछ चीजें यहाँ प्रेजेंट किया हूँ जी।
बहुत बहुत धन्यवाद आपका। आपने एक अलग ही विधा के बारे में अलग तरह से चला, बहुत ही अच्छा, धन्यवाद। ऐसे मिलते रहिए, आते रहिए, ज्वाइन करते रहिए।
जी जी
धन्यवाद, धन्यवाद, बहुत बहुत धन्यवाद। मैं अब अपने तृतीय वक्ता डॉक्टर हेमा मालिनी जी को आग्रह करता हूं Dr. Hema Malini ji from Tamil Nadu, Chennai. She young, dynamic expert, Ayurvedic expert, and would like to share her views on heart care. Welcome, welcome.
Okay. Namaste to all the respected and hearty souls present here. And I don't know what I'm going to tell now, because from A to Z, all the prior eminent speakers have covered. So I'm here just as a lifelong learner. I'm going to share just my experiences and certain opinions also, and a few of my learnings. And I'm learning a lot from this platform. And I'm very grateful and thanks to all the dignitaries. Okay, so today being the 22nd World Heart Day, the motto for this day is use heart for every heart. So fighting the cardiovascular disorders with every beating heart. So the agenda for this session will be like bringing awareness and betterment to the upcoming generations to propel forward in a productive way. So I always start my session with the mindful prayer. And this area denotes our Anahata Chakram, where the heart relies. Okay, so I'll start my session with the Nirukti of Hridaya. Nirukti. We can see heart in two perspectives, anatomically and emotionally also. So Hru here refers the abduction. So it is just present away from the midline. Hru. The is to donate the blood. And here refers to the rhythmicity, the contraction and the relaxation of the heart. So here we can see the anatomical and physiological aspect of the heart in the Nirukti itself. And also the emotional part also have its effect here. Hru is the acceleration, that is in Hrillasa we see Hru. So Hrillasa, that acceleration Hru, Daya is the compassion. So the heart is seen as the fountainhead for all the emotions. So here we can see anatomical and emotional parts of the heart. So the paryayas used by our acharyas are Mahat, Mahamulam, or Chittam. So these are the terms where our acharyas directly do not refer it as the heart. These are the terms. And the main attributes of this heart are, it is one of the three marmas, one of the Sadhyo Pranahara marmas, Sira marma, and it has three shrotas involved here. Pranavaha shrotas, Rasavaha shrotas, and Manovaha shrotas. So every aspect we can see the emotional tinge touching it. So, okay, now we can come to the point where certain acharyas say that Shirastha Hridayam is Mastishka and Urastha Hridayam is Hridayam. So how can we justify this? Urastha Hridayam is Hridayam as such. How can we justify this? We can justify this with two entities. Adho Mukha Pundarika Sadrisha. So the apex of the heart is pointing downwards. And this one is the anatomical part, and physiologically, Prasuptat Sankochayati, Jagritat Vikasayati. So this one shows about the systole and the diastole. So this actually justifies that the Urastha Hridaya is the Hridayam, what we refer to as the heart. So now we can see about the different perspectives about the anatomy, physiology, in everything, how the acharyas have referred to it. So anatomically, urasya stanayor madhye, it is present in the thorax, and then it has the kapha and the rasa pradhanam. Kapha rasa pradhanam. So kapha here refers to the muscular part, rasa refers to the vascularization, kapha and rakta. Kapha, rakta, prasadanam. So kapha here refers to the muscular part, rakta to the vascularization. And then comes the moolam. Here we use 3 moolas, pranavaha shrotas, rasavaha shrotas, and then manoha shrotas. The moolam is pranavaha moolam and rasavaham. We can see it in the modern perspective as pranavaha. We can correlate with the pulmonary arteries and veins, where it correlates with the lungs, and rasavaha correlates with the aorta and superior and inferior vena cava. So somewhere we are getting correlated with the modern perspective also. So coming on to the physiology part, Vyana Vayu. So Vyana Vayu, here we see the complete circulation of the blood throughout the body. So the circulation aspect and the tone of the blood vessels is also maintained by the Vyana Vayu. Then comes the Sadhaka Pittam. Sadhaka Pittam, I have wondered many times, and because it is also a subjective thing where we can't see that. But after referring to certain texts, came to know that they are referring this to the conduction of the heart. So the sinoatrial node, and then the internodal pathway, then comes the atrioventricular node, that is, we call it as the bundle of His, and then comes the branches, and then the Purkinje fibers. So the complete thing, the initiation of the heart, the electric conduction of the heart, they refer to as the Sadhaka Pittam. And Avalambaka Kapham is the lubrication and the strength. So the pericardial fluid and the pleural fluid can be referred to this. This is just my understanding, and the eminent dignitaries present here can kindly enlighten on this more. And so now, and one more point is the valvular function. The valvular function is rendered by the Dhananjaya Upaprana Vayu. So this is an additional information. The Dhananjaya Upaprana Vayu helps in the valvular function of the heart. Okay, now we can see the physiological, psychological aspect of the heart. Psychologically, when the thought process is positive, automatically the pH value of the blood is maintained, and the circulation is proper. And vice versa, if the thought process is in a negative aspect, the biochemical changes occurs, and the pH of the blood becomes acidic, and the circulation, the viscosity of the blood turns somewhat thicker, and the circulation reduces, and the stagnation of the toxins occurs. And this is where we see the rasa vaishamyam, that is amatvam. So this leads to the hridrogas. And embryologically, Charakacharya says in the 3rd month, the heart's viability is seen. And some other acharyas are referring to it in the 4th month also. But Charakacharya is emphasizing on the 3rd month. And now comes the very important part, that is the emotional part of the heart. We see that the DNA of the heart and the brain are somewhat similar, and we call it as the heart and brain coherence, or the heart and brain symphony. When we see in the Alzheimer's health seekers, they suffer with the cardiovascular disorders. So this denotes that the heart and the brain is somewhere related, because around 40,000 neural circuits are in coherence with the subcortical areas of the brain. The 40,000 neural circuits of the heart is in contact with the subcortical area of the brain. And one more important thing is the heart is 100 times more having electric energy than the brain, and 5,000 times more magnetic energy than the brain. So such a powerful electromagnetic ocean this heart is. So we get the term emotion also as electromagnetic ocean. So these are the things, these are the areas we can see that heart is not only the physical heart, it is a holistic thing where we can approach it in a very tender way. Okay, now we'll come into the hridrogas. Hridrogas, our acharyas have mentioned again in different ways, like hridpida, hridgada, hridgraha, and Acharya Charka has mentioned it as in the Trimarmiya Adhyaya, Sushrutacharya in Hridroga Pratisheda Adhyaya, and Ashtanga Hridayakara in Chardi Hridroga and Trishna Adhyaya. Okay, now coming on to the Karanas. What are the Karanas? As our previous speakers, both of the eminent speakers have covered completely. So I'm just going in a very fast manner. Asatmi Ahara Viharas. Kleda Abhishyandi Aharas. This again leads to the Amatvam. Amatvam, the Rasa Vaishamyata, and it affects the Amashya, and that Ama again goes into the Hridaya where it is the depot, it is the terminal where it goes in contact with the endocardium of the heart, and again it infects and spreads all over the body. So everything starts with the food we eat. So first is Asatmi Ahara Viharas. Second is very important point, Vega Dharanam. Because in almost all the Vega Dharanas, we see the aspect of Hridroga, especially in Apana Vayu Dharana, Apana Vayu Vega Dharana, and Udgara. In these two, it is specifically mentioned about the Hridroga. So it is better to go with it rather than suppressing it. And then comes the Shrama. Shrama is the fatigue, extreme fatigue, and extreme work, as the previous one of our previous speakers said. Even the strenuous exercises will be the cause of the Hridrogas. And then Bhaya, Shoka, and Chittodvega, that is anxiety. So all these are the basic Karanas for Hridroga. And then we'll come into the Vedas, Vatika, Paitika, Shlaishmika, Sannipata, and Krimija. So Vata, we can refer to the rhythm, is the abnormal rhythm disorders of the heart, like the Sramsam, the prolapse, Sankocham, stenosis, and Urdhva Pravritti, regurgitations. All these we can correlate with the Vatika type. The main symptoms will be the pain in the precordial region and fainting. So for this, we can use Dashamulak Vata with the Pipali Churna. And for Paitikam, it is mostly the carditis, all the carditis, mainly the myocarditis. Here, as they are all mentioned, we can see the Daha and Trishna here. The main symptoms will be the Daha and Trishna. And here we use Arjuna Kshirapaka, Lagu Panchamula Kshirapaka. And Shlaishmika, it can be correlated with ischemic heart diseases, congestive cardiac failures. And the symptoms will be like hypersalivation, Praseka, Arochaka. These will be the primary symptoms. And we can use Trivrit Churna, Eladi Churna. These are the Prashama Aushadas. Then coming on to the Sannipatika. So all these three things together. So here Langanam is basically done. And Krimija, rheumatic heart disease, and infective endocarditis. So here we see the phrase, it licks the joints and bites the heart. So RH, rheumatic heart disease, it licks the joints and bites the heart. So here the Krimihara Aushadas are used, mainly Vidangadi Churnam is also used here. So these are the basic things as our speakers have already covered. I'm going in a fast way in all these things. And coming on to the main Chikitsa Sutram, we see just a minute. Yes, Agni Deepanam. Yeah, Agni Deepanam, Shroto Shodhanam, Anulomanam, Langanam, Hridyam. And these all correlates with the Gulma and Udavarta Chikitsa. So here mainly Amla Rasa Dravyas are used. Why Amla Rasa Dravyas are mainly used? Acharya Charaka has mentioned about the Mahakashayas, Amra, Amrataka, Lapucha, Karamarda, Matulunga, all these Amlavetas, and then Kuvala, Badara, all these things. So why has he mentioned mainly about Amla Rasa? Amla Rasa, when we see the Bhutas, it is Prithvi and Agni. So Prithvi is Kapha and Agni is Rakta. So as we already saw, it is Kapha and Rakta Pradhanam is the Hridaya. So we use Amla Rasa Dravyas here. When we see it in the chemical constituents also, the flavonoids, antioxidants, this helps in the vitamin C mainly, helps in the cell growth. So generally we use Amla Dravyas for Hridaya. And also it also helps in the horripulations and stimulation of the heart. So as we see it in the emotional aspect also, it gives a stimulation to the heart. So these are the areas of the treatment principle. So again, I'll just go through it. Agni Deepana, Shrotos Shodhana, Vatanulomana, Langana, Lekana, Hridya. Hridya, we use the Amla Rasa Dravyas. And as doctor said, the Chikitsa Sutra as per the Charakacharya is Ojasyam. It should be very much conducive to the Ojas, and Shrotasam Yet Prasadanam. It should be very conducive to the Shrotas also. And Tat Sevyam Prayatnena Prashamo Jnanam Evacha. So they refer to the, he has referred to the diet, drugs, and behavior. So these three things are mentioned by the American Heart Association also. So you see the very correlation from our acharyas till now. The same things has been said. So the diet, drugs, and the behavior. When we come on to the diets separately, we can it is mentioned about the eating of the healthy organic foods, unrefined, unprocessed foods, with less cholesterol and with less acidic nature food. And Acharya Gayadhasa has mentioned about the Raktashali and Takra usage along with Dadima and Amra also. And in Dhanvantri Nigantu, we can see that the rock salt is mentioned as the Hridya. So these are the simple things about the diet. And coming on to drugs. Drugs, we can see almost 13 single drug formulations and 133 formulations together. So in the University of London, actually, they have formulated 6-in-1 pill. 6-in-1 is 1 part is statin, 3 parts of hypotensive drugs, 1 part is folic acid, and 1 part is aspirin. Yeah. So all these together in 1 pill. So likewise in our study also, in one of the research, they have combined 6 drugs together. That is Guglu, Arjuna, Pushkaramola, Jatamamsi, Lashuna, and Amalaki. So it has been proved well that this combination works very well with the Hridaya health seekers. And one more thing is, Trikatu is also used widely. Trikatu, Haridra. In Arjuna, we have this arginoloic acid. So this Arjuna helps to be a very good cardioprotective. So Haridra is not only used in Ayurveda, it is also used in all the other Ayush systems also for Hridaya. And we can see the Erenda usage, Shigru, especially Shigru, and Chitrakamula. Yeah, Chitrakamula, all these are very well used in Hridaya. And in emergency conditions, we use this Hingu Churna. Hingu Churna along with Lavana, along with some Hridaya Dravyas. When we give this, immediately that stimulation of the heart will be there, because it helps in the Apana Vayu, clearance of the Apana Vayu. Okay. Now coming on to the behaviors, that is the Viharas. So again, we see that in 2017, the Harvard University, they have found out the inadequate sleep to be the basic cause for cardiovascular disorders. And this is what our acharyas have said just a very long back. So these things say that we are much ahead of all these things. And once we start following these things, we'll be out of these things in a preventive way. And then comes this usage of the pranayama, yogasanas, yoga nidra. All these things will surely help us to prevent heart diseases. And we see 23% of the global population is affected by these cardiovascular disorders, mainly with the improper viharas. And 43% of the females in Europe are again suffering with the cardiovascular disorders, again with the unwanted habits like the smoking, drinking. And when we try to bring these under control, our blood sugar levels, our blood pressure, all these, when we and then the BMI, the index, BMI index, when these are under control, definitely our heart will be protected in a very well manner. And then now I'll be covering about the Hridaya Varnam. Hridaya Varnam is again said by Charakacharya in the Visha Pratisheda Adhyaya. And here Visha not only refers to the direct Visha, it is the pollution what we suffer in these days. So the pollution is actually affecting the heart along with the lungs. So it is again, it has been the Tikshna, it reaches the Rasa Dhatu and again Dhatu into the Hridaya. So the Acharya has mentioned about the usage of Grita. So the heart being the Pranadha, it should be protected first. So Sarva Upakrama, it should be protected in the first basis. So he is saying about the usage of Gritam. Grita Sevana in Nitya Upalabdhi. So Grita being Anabhishyandi, the liquefied ghee, what we use, the cow's ghee, it is Anabhishyandi. So he says it has the Nitya Upalabdhi, as it neutralizes the residual effects of the Visha. So we also use Gugulu Tiktaka Gritam in also certain cases. So that it has to be mentioned here. And very interesting fact is we also see certain receptors in the heart, the cardiac receptors. These cardiac receptors are basically classified into chemical and mechanical. These chemical receptors help to detect the value of oxygen and carbon dioxide and pH value of the blood. With these chemical receptors which are present in the aortic valves. And also we see the mechanoreceptors or the baroreceptors. which detects the increase or decrease in the BP. So these are the subtle aspects we see in the cardiac receptors, and we also see certain taste receptors, sweet and bitter receptors. Usually we refer heart to the sweetness, but it also has bitter receptors. 29 bitter receptors are seen in the cardiac, that aortic arch. We see these bitter receptors, and we refer it as the embitterment in psychology also, because when we say that certain things, it causes happiness and sorrow, everything, that melancholy, everything happens here. So we can correlate with in psychology also. So these receptors, these taste receptors helps in the nutrient sensing and also in the contraction and relaxation of the hearts. So every part of the heart has its own importance. Yes. And one more thing is it's a fascinating fact that the heart transplant, till now it has not been that much, very much efficient. In 1967, we see Dr. Christian Barnard has done it on Mr. Louis Vashkansky, and he has survived just for 18 days after the first heart transplant. And even now in the University of Minnesota, Dr. Doris Taylor is trying with the bio-artificial hearts in the labs, but she is saying that when we try to do this, we have to use the immunosuppressant drugs, where we have to trade one disease for the other. So till now, it is not being given that much of significance for the transplantation. And finally, I'm going to conclude my speech with the emotional part of the heart, where we correlate with the Anahata Chakram. Anahata Chakram is the heart chakra, where we see that the biomedical parameters of the health seekers who come to us will be normal, but they'll be having certain symptoms related to the heart. How come this is possible? So I have seen certain cases where when we probe into the previous history of the child, even from the childhood, we can see that in certain areas, the love giving and taking would have been somewhere blocked. That kindness, compassion, something some curbing would have been there, and that will cause the symptoms as the anatomical disorders of the heart. So this is really a different fact to be observed. So for this, we use certain mudras and chantings, and I really prefer everyone to go with this, because it gives a tremendous effect, and we are seeing it in the day-to-day cases, and even we are following it. And I'm going to just show the few of the mudras. And we correlate this with the color green, because green is always correlating with the nature, soothing effect. It's a calmness. So it enlivens something. So enlivens the relationships. So for the physical heart, if there is any blockage, definitely we can use this Apana Vayu Mudra. And it is also called as Tamrita Sanjeevani Mudra. So this helps to bring back that stimulation, electric stimulation, within 20 minutes after suffering from any angina also. So such a powerful mudra this is. And I wish everyone should know about this, even the children in the family and everyone, because it will be very preventive in nature, and it will help to save some life somewhere. So this is the Apana Vayu Mudra. And then this is the Prana Mudra, because this enhances the functioning of the lungs. So as we see, the heart and the lungs are together working in a very coherent way. So we use these two mudras together. Apana Vayu Mudra and Prana Mudra will help to enhance the stimulation of the heart to beat up again. And coming on to the sleep, so sleep will be the major factor here. So to get a proper sleep, we use this chin mudra. So we have to keep it in the center part of here, and being the other three mudra, the three fingers very much relaxed, and this helps to give us a proper sleep. So proper sleep will give us proper excretion, proper digestion, everything will, the circadian rhythm will be properly maintained. So we can use this chin mudra for sleep. And finally, this Purna Jnana Mudra. So left hand on your lap and right hand placed on your heart. So by doing this mudra and the chanting we have to do is Bija mantra is YUM, yum. So by doing this, the hertz of this is 639 hertz. So by doing this, automatically the Anahata chakra opens. And we see the excellent results for this. And you can try it on a daily basis so that the heart symptoms are getting relaxed, and we are observing a whole lot of changes. Even the way we approach the other people, the relationships enhancement, everything starts blooming by doing these mudras and chantings on a regular basis. So once I'll do this, yum. So while doing this, you can see that the vibrations just extend around like to 8 to 10 feet. And in one of the previous speeches, I remember Dr. Madanji has said about the torus field. This is nothing but the electromagnetic radiations which are just around us in the downward shape, 360 degrees. So it comes and goes into this Anahata chakram in all the 360 degrees. Once it is open, automatically all the unwanted things which are blocking the movement of these energies will help us to gain more unconditional love, acceptance, appreciation, surrendering to this universal energy, and whatnot, self-contentment, and mostly the gratitude. So by following all these things, definitely we can maintain a healthy heart and healthy lives for the upcoming future. With all these wonderful things, I am just thanking the organizers for giving me this chance. And thank you once again. Have a healthy heart, have a healthy life. Thank you.
Thank you. Thank you very much, Dr. Hema. Thank you very much. Now, without wasting much time, I would like to request Dr. Swagat
Yes, sir.
from Agra. He is professor. Welcome, Dr. Swagat. Welcome.
It's a very warm good evening for all dignitaries. I hope nothing is left for me. Everything is clearly covered. And finally, something is left. And it's only my experience what I have to tell. The theoretical part, all the yogasana part, Swastavrita part, everything is covered by all the speakers. Only thing what I can just share is something with my experiences. So before wasting much time, I will start with Madam was telling that the heart is in
which has got its own value. It is Pundarika.
थोड़ा लाइट फेस पे कर लीजिए, लाइट थोड़ा लाइट फेस पे नहीं आ रही।
हेलो सर, आप कुछ बोल रहे हैं? Am I audible? Hello. Hello. Pawanji, am I audible? Hello.
Yes, now it's clear. Clear.
yes. The Hridaya is the Adhomukha Pundarika. Pundarika refers to a lotus bud. Why it was, there are many buds, inverted buds. Why it was only lotus bud? Because the lotus petals, they are cardiotonic. In China, they make a tea of lotus leaves. In India, we don't drink. If we browse, we may get somewhere in the China websites. Lotus leaves, they take and they clean it and dry it, and they drink every morning. It is a very good cardiotonic, lotus leaves. That is the reason Ayurveda Pundarikaksha has been specifically mentioned. That is one reason. Next, coming on to the next region, our first speaker, Rajendra sir, was telling that the ischemic conditions can be revived and infarctions cannot be revived. In my experience, I don't have that experience, but in the last year speaker, our Kakani sir has said the Rasayana therapy, wherein it can be reversed. Swarnabhasma Rasayana therapy with the honey and the grita, when given for 42 days, it can reverse even the ischemic conditions. This was, he explained me, because the next day we had a huge discussion regarding that. Sir has explained, Kakani sir, that there is a chance of reversal also. This is just for the knowledge sake. And in the acute conditions, this is from my guru, Vaidya Tapanji, he has taught me. And in the initial say, we give golden water. Golden water every 4 hours, initially with 6 to 10 drops, then we increase gradually, then it decreases. This is the golden water what we prepare. Golden water is given, and in the exact very phase, the Nagavali Swarasa is given. This is acute cardiac MI out of it. Nagavali Swarasa is given for 5 to 10 ml, and the drug what we use is we paint the tongue with the Sringabhasma if it is available. Sringabhasma is available. We paint the tongue mixed with the honey, Sringabhasma. Why we paint on the tongue is it is sublingually accepted very fast. It takes only 3 to 4 seconds to reach the heart. And one of my friend was telling, sir was telling that tobacco smoking. It is not only a form of tobacco smoking. Tobacco in any form is cardiac. What you can say? It is attacks like a visha for the heart. Okay, anything which nowadays smoke rather than smoking, all this pan para, gutka, chaini, kani, all these have come. They are very worst things. Which more than smoking, also they are worst things. They are cardiotoxic drugs which hamper the functioning of them. And if we see that cardiac diseases, there is a long list of cardiac diseases. We discuss only the people we mainly discuss of regarding cardiovascular disease. So coming back to cardiovascular disease, here we have to see the integrity of the vascular structure. So what is the thing which maintains the integrity of the vascular structure? If you refer to dushas of the Rudraga, it is the Meda Dhatu which does the maintenance of the integrity. That is the smoothness, elasticity, and softness that is maintained by the Meda Dhatu. How the Meda Dhatu is destroyed? For two things. First thing, because of the Divasapna. Nobody should do Divasapna unless it is Varsha Ratu. It is clearly explained. If it does, we are going to spoil the Meda Dhatu. Meda Dhatu Dushti occurs. This is the one thing. Second thing, Ratri Jagrana. Ratri Jagrana causes the Rukshata. Rukshata, again, there is the depletion of the Meda Dhatu that causes the dryness in the, because we have got two things in the cardiovascular heart attack. That is, one is the spasm, other one is the blockage. So in these two conditions also, the sleep is the main pattern where if we disturb in that, this Kanda of Ayurveda, Ahara Nidra Brahmacharya, this Nidra is most important. Everybody, unless old people, has to take undisturbed 8 hours of sleep. This is one thing what we have to make very clear when we are explaining our patient, other than the medicine what we give. Undisturbed 8 hours of sleep. And next is golden shower. I say already our sir has explained. Still, I give that word golden shower. What is that golden shower? Unlike drinking other tea, coffee, and all, every morning when you wake up, drink a hot glass of water, sip by sip. Water will act as a golden shower to all your organs. It will detox your everything. And next thing, what we do, if at all there is an acute condition, emergency condition, anything, any oil, especially medicated oil, not the sunflower oil, medicated oil, or the Ghruta and Madhu, take it and apply near the heart region. This is the first thing what you have to do. Second thing, as Madam has showed you, the mudra, main is the Apanavayu mudra. That acts within 5 seconds to 6 seconds. The complete process takes much longer, but the action is, study has been conducted. It is acting very fast, even faster than the sublingual isosorbitol. It is faster than that. It is proved and it is done. So why we have to maintain? I'll just teach you one thing. This is the thumb is for the Agni. This is Agni. So anything which is connected is the other Panchamahabhutas. Agni with Vayu, Agni with Akasha, Agni with Prithvi, and Agni with Jala. So whatever you want to connect, you have to balance it, you have to touch it. If you want to reduce it, you just touch the bottom of the finger. So here now we are reducing the Vayu by connecting it to the bottom of the finger to the Agni. Vayu is reduced, and other two, that is the Akasha, is a space, and the Prithvi Mahabhuta, both are enhanced. So we have to enhance this. Here you can see that we are never ever reducing the Agni. Agni is kept intact. So that is one more reason we have to enhance the Agni. Agni Pachana and Rakta Prasadana. These are the two things which you have to maintain. So for that best drug, what we use is Tapyadi Loha, what we use as the Rakta Prasadana drug. There are many Rakta Prasadana drugs which have been explained. Tapyadi Loha is the best Rakta Prasadana drug. Even you can ask in cerebrovascular accident as well as cardiovascular accident. Both in you can use the Tapyadi Loha. Usually we use with Avipatikara with Tapyadi Loha and Abrakavaspati. These are the things combination what we give for the Rakta Prasadana. Next is the Agni Deepana. You have to do, in acute cases, you have to initially act immediately for the Agni Deepana. That depends on the prakriti of every individual and the availability of drug. You have to do the Agni Deepana. So these are the things you do. Now coming on to congestive cardiac failure, there are lots of diseases. One the specific explanation what I want to give is, we had experience. This is an experience. I was doing my final year PG, and we had a cardiac Manjushadi Ksharabasti we give, and Manjushadi Ksharabasti gave a wonderful result. And the last day, the patient got discharged, and everything billing was done. Everything, he was about to go, but suddenly he had a cardiac arrest. Why I'm telling this is excessive Kshara. Excessive Kshara or excessive triggering can also induce the cardiac arrest. The patient died on the hospital bed only. This is my experience, what I'm telling. So, giving Ksharabastis or application of Ksharas, you have to be very careful, because again it can trigger the cardiac arrest also. And one more thing, our sir was telling that we have to do the Anulomana, Vata Anulomana. Vata Anulomana, rather than Erandathela, what it does is, it does some contractures in the painful abdomen. So the Katuki was the best drug in cardiac diseases. As per research, Katuki, when given in 2 to 3 grams, is giving the very much ease in the laxation of the stools. So the cardiac patient should not stress over that. But when there is an abdominal contracture because of the Erandathela, that may have some bitter experience, and patient cannot bear the pain also. So for that purpose, we use usually the Katuki Churna, 3 to 5 grams depending upon the poster, that will ease the laxative effect, and the patient is very much impressive on that. And other drugs, everything is said, and I don't think I have much things left out in my experience to explain that. And one more thing, what we have to also make very sure is the Omkara and Pranayama. Omkara and Pranayama, every person has to do that. And last, what I can say is, even Ayurvedic doctors, because nowadays we are also telling that astrology should one of the science which should be included for the Ayurvedic doctors. Coming on to the astrological part, when the Surya, many of the people may know, Surya, it is the sun. If he is depleted, or if some problem is there with the Surya, the person will have cardiac disease. This is a research-based telling, what I am telling. For that purpose, the best remedy is the Yogasana, do Surya Namaskara. Surya Namaskara, doing early morning Surya Namaskara will keep you wired astrologically as well as the yogasana also. This is an added benefit. Next is for Surya, it is the Tamra, what is being best used. So give Tamra Basma with honey, and there is an Lekana happening. So you can both you can mix this astrologically as well as the Ayurveda medicines and then treat the patients. Thank you, and all. I will not take much time. Thank you. Thank you very much.
Thank you, Dr. Swagat. Thank you very much for your fine flow and fine experiences. Excellent. Thank you very much. Thank you very much for joining and sharing your experiences with us. I would like to request if Dr. Sophie is available to us. Dr. Gulamuddin Sophie Sahib. Khushamadi, Dr. Sophie is Head of the Department Pharmacology of National Institute of Unani Medicine. If he is available, I would like to welcome him. But excellent, Dr. Swagat.
Thank you, sir.
Agnihotri sir, your comments. Respected VK Agnihotri sir. I hope disconnected. So I would like to request Dr. Harish Verma, Gulamuddin Sophie Sahib. Welcome, welcome. Today on Heart Care from Unani side. Kindly unmute yourself.
Namaskar, sir.
Namaskar, namaskar.
Sir, it was very much thrilling to hear all these lectures by various dignitaries who you have called for. They have given enough light about what Ayurveda speaks for this heart disease and its treatment. In Unani medicine, sir, we take it in a very different way. We think that there are three faculties which govern whole of the body. Vegetative functions are because of liver, and we consider it as primary organ. And this animalistic soul, it lies in the heart, and it governs the functions of heart and vessels. And then there's the psychic soul or psychic faculty, which governs the control of our body through nerves and other organs related to the nervous system. This heart has been very much debatable thing, whether heart is the primary organ or the brain is the primary organ. There has been very much debates in Unani medicine. And those people who say that the heart is the most primary organ of the body, they have their own views. And those people who say that brain is the highest or the most pivotal this organ of the body, they have their own views, and they have guided the tip in a very different way. For this heart, the people who think that heart is the main organ, they have started this discussion about what are emotions and what are the various diseases which are likely because of the problems with heart, or various faculties which are governed by heart, wherein there may be inhibitions or too much outward flow of the cardiac faculty. So various emotions have been related to heart, but today we see that emotional axis, it is epinephrine and this norepinephrine and related to dopamine, which is usually central nervous system. So these debates have been going on from centuries, and today even we don't know whether the gut has this brain or our main brain is functioning as a controlling organ. So these debates will remain there. But how we treat our diseases? In Unani medicine, we have specific categorization of cardiac diseases. And there we have the idea of various drugs, what we say accelerating drugs, what we say mufarraha, accelerating drugs. Those drugs, if the disease inhibits the soul of the heart, we have the drugs which helps it to reinvigorate these or accelerate the body. Then there are various other, say for example, we have cardiac tonics, specific tonics which are for heart. Those diseases are there where we use the cardiac tonics. And then we have vessel dilators and vessel these constrictors, which are used in various ways. So this concept, which Unani says about this concept, but the diseases, like say we have the symptomatology. For example, we say we have palpitation as a disease, not as a symptom. Similarly, anemia in Unani medicine is a disease, not as a symptom. Similarly, we have various types of anemias. But there is a need that if present classification of medicine is there, how we classify it accordingly. That is, we have to delve deep into our literature and then find various conditions, how they mimic to the present state of these diseases. And then we have to say, yes, if these criteria fit our classical these descriptions, we say this is the disease. But about this, what usually people say about correlating something with some disease, it has become a syndrome in traditional medicine, only trying to match our descriptions with modern medicine. That has created a lot of problems and misunderstandings between the traditional text, what it is saying, and between what we want to make people think about what traditional medicine is saying. So these two things, this perspective, which I wish to just present before you, so that our august audience thinks about it. They need to think about these things. Then we have one book in Unani medicine written by Ibn Sina. It is basically, it's called Book of Cardiac Diseases. He has mentioned 64 herbal medicines. In one way or the other, they are affecting the cardiac system. What effects they have. So this what the book is. It is basically Adviye Kalbiya, the drugs of cardiac diseases. It is recently translated into English from Aligarh. So that book may help the other people to know what, how, and generate very much research about various aspects of the drugs used in Unani medicine and how it cures the disease. Thank you, sir. Thank you very much for giving me this small, this time, this opportunity to discuss with you, stalwarts. Thank you, sir.
Great as always. You are the ocean of Unani knowledge. Welcome. आपका स्वागत है. हमेशा आप बोला कीजिए. हमें यूनानी का भी पक्ष चाहिए हर विषय पे. मैं अब इस सेशन के वैलिडिक्टरी ब्लेसिंग्स के लिए उस अग्निहोत्री जी को स्वागतम करना चाहता हूं. उसके बाद अग्निहोत्री जी के हाथ में सेशन होगा और वो जैसा चाहेंगे वैसा ओपन सेशन हम 15-20 मिनट और कर सकते हैं. वेलकम अग्निहोत्री साहब. वेलकम.
आज थोड़ा नेटवर्क की प्रॉब्लम हो रही थी, तो बीच में अभी हम सुन नहीं पाए स्वागत जी को. बार कुछ डिस्टरबेंस था. बड़ा अच्छा रहा आज डिस्कशन में. बहुत लोग जुड़े, बड़ी खुशी हुई. आज हमारे पास करीब एक टाइम 34-35 लोग हो गए थे, और स्पेशली जिन 2-3 लोगों को जो बड़ी सीनियर डिग्निटरीज हैं, लाइक प्रोफेसर डॉक्टर हरीश वर्मा जी और प्रोफेसर ई शर्मा जी और डॉक्टर सोफी जी भी जुड़े. तो हम चाहते थे इनके भी कुछ विचार आ जाते. इनमें से आप किन्हीं को अगर हरीश वर्मा जी तो जुड़े हुए हैं.
जी सर, प्रणाम.
जी नमस्कार.
स्वागतम.
प्रणाम डॉक्टर, प्रणाम. So Dr. Swagat ji, I have a question for you. Kindly share your experience how to prevent atherosclerosis. It's very challenging in West, rather in India also. So if you can share your experience about any Ayurvedic medicine, how to prevent atherosclerosis, that will be very helpful for us. Thank you, sir. डॉक्टर
हमारे
स्वागत जी,
साथ स्वागत जी भी हैं, दैवत बोरा जी भी है, हेमा जी भी है, और अभी डॉक्टर राजेंद्र प्रसाद जी आज अभी शायद नहीं है हमारे, है ना? स्वागतम। तो डॉक्टर राजेंद्र प्रसाद जी से मैं आग्रह करता हूँ
जी
इस प्रश्न के जवाब देने का।
जी जी
प्रोफेसर फ्रॉम BHU, डॉक्टर राजेंद्र प्रसाद जी, स्वागतम।
जी हाँ, स्वागत है, स्वागत है।
थैंक यू सर। तो इट इज़ वेरी कॉमन कि सब अभी डॉक्टर हेमा मालिनी ने बताया है, योग वगैरह तो करते ही हैं, लेकिन इन कॉमन मेडिसिन अगर हम लोग खाना चाहते हैं, मेडिसिन कहें या फिर कहें कि डाइटरी सप्लीमेंट में, तो आई डोंट नो कि आपको टोरंटो में गार्लिक यूज करते नहीं करते, बट गार्लिक लहसुन इज वेरी गुड फॉर दैट पर्टिकुलर हेल्थ. इट इज वेरी गुड एंटी हाइपरलिपिडेमिक, एंटी हाइपर एंटी डिसलिपिडेमिक. इससे हम लोग कोलेस्ट्रॉल काफ़ी अच्छा कंट्रोल कर सकते हैं, या यूँ कहें कि अगर उसको रेगुलर ले रहे हैं तो कोलेस्ट्रॉल नहीं बढ़ेगा, उसके लिपिड्स नॉर्मल कंट्रोल में रहेंगे. उसके अलावा खाने में डिफरेंट काइंड जो एडिबल ऑयल हम लोग यूज़ करते हैं, तो स्टार्टिंग फ्रॉम सोयाबीन यूज़ करते हैं. सोयाबीन को इतना अच्छा नहीं माना जाता आज की डेट में, लेकिन अदर ऑयल्स हैं, सनफ्लावर ऑयल है या राइस ब्रान ऑयल है, इनमें कि बेसिकली एक हम लोग एक कंसेप्ट है या फिर ये प्रूव्ड भी है कि जो ऑयल्स ओमेगा-3 फैटी एसिड्स उनमें ज़्यादा होता है, तो वो दे आर वेरी हेल्पफुल टू कंट्रोल लिपिड्स और कोलेस्ट्रॉल. तो उन ऑयल्स को हम खा सकते हैं, सूरजमुखी सनफ्लावर का ऑयल हो या ऑलिव ऑयल है या राइस ब्रान ऑयल है, इन ऑयल्स का सेवन करें. खाने में लहसुन, गार्लिक को हम लोग फ्रिक्वेंटली यूज़ कर सकते हैं, वो प्रिवेंट करेगा. और बाकी चीज़ें तो सब के सब मेडिसिन में आती हैं कि मेडिसिन के रूप में लेना है, चाहे वो अर्जुन है या गुगुल है, उसकी प्रिपरेशन है, देयर आर सो मेनी थिंग्स, तो वो डिफरेंट चीज़ है. अदरवाइज इन कॉमन आई कैन से कि ये जो खाने में सप्लीमेंट है, फूड सप्लीमेंट है, उनको हम यूज कर सकते हैं, जो कि कोलेस्ट्रॉल लिपिड्स को नहीं बढ़ाएंगे.
डॉक्टर साहब, एक BHU में रिसर्च हुई है जो डॉक्टर SM त्रिपाठी जी ने की है
जी.
थोड़ा देखिए इसके बारे में, जो BHUX करके पेटेंट पॉलीहर्बल फॉर्मुलेशन टू प्रिवेंट एथेरोस्क्लेरोसिस. इसमें भलातक और इसमें कुचला है, ये देखिए थोड़ा इस पे आप अगर प्रकाश डाल सकते हैं. इसका कॉम्बिनेशन देखिए क्या है, कॉमिफोरा म्यूकल टर्मिनेलिया अर्जुना.
जी, SN त्रिपाठी नहीं, ये उनके बेटे हैं YB त्रिपाठी. ये हमने
हाँ जी, उनके बेटे हैं.
ना, ही इज द मैन ऑफ मेडिसिनल केमिस्ट्री. ये इनकी एक्सपेरिमेंटल स्टडी है, एक्चुअली जो एक्सपेरिमेंटल स्टडी है, इसको इन्होंने किया था और इसको पेटेंट US पेटेंट भी कराया था इस स्टडी में. तो इसमें बाकी चीजें तो बिल्कुल कन्वेंशनल हैं, जैसे कि ये अर्जुन है, अर्जुन को हम लोग यूज करते हैं, गुगुल को यूज करते हैं, लेकिन हाँ ये कुछ चीजें डिफरेंट हैं, जैसे सेमी कार्पस एनाकार्डियम में भल्लातक है
जी,
और कुछ चीजें हैं, तो उसको इन्होंने ऐसा माना है कि जैसे बॉस्वेलियस सेराटा है, तो ये हमारा जो शल्लाकी उसको बोलते हैं, तो शल्लाकी जो है एक्चुअली ये एंटी इन्फ्लामेटरी है.
जी.
तो इनकी जो स्टडी है, इसमें स्टडी में इन्होंने देखा कि जो हमारे माइकोर्डियल इंफार्क्शन होता है, जैसे कि हम लोग जानते हैं इसकी पैथोफिजियोलॉजी जो है कि जब ब्लड सप्लाई रिड्यूस होती है मायोकार्डियम को, तो ब्लड सप्लाई रिड्यूस होने के बाद वहाँ पर एक काइंड सम सॉर्ट ऑफ इन्फ्लामेशन होता है. इन्फ्लामेशन के बाद ही ये सारी प्रोसेस की जो मैकेनिज्म है वो कंसिक्वेंसेस होती हैं कि इन्फार्क्शन जो कुछ हुआ. तो इन्होंने इन ड्रग्स को इस तरह यूज किया है कि दे आर वर्किंग एज एंटी इन्फ्लामेटरी. कहीं मॉडर्न मेडिसिन में भी ऐसा कुछ यूज करते हैं कि एंटी इन्फ्लामेटरी मेडिसिन को यूज करें तो वो इन्फ्लामेशन कम करेंगे, तो वो जो पैथोलॉजी अंदर डेवलप हो रही है इन्फेक्शन से, उसको ठीक करेंगे. ये कंसेप्ट इन्होंने मांग के चला है. इसको हालांकि हमने उनके साथ मिलकर हम कुछ अप्लाई भी किए थे क्लिनिकल वर्क के लिए, तभी क्लिनिकल ट्रायल जो पेशेंट्स पे होना परफेक्टली नहीं हो पाई है, उसको हम लोग करने को प्लान कर रहे हैं. ये एक्सपेरिमेंटल स्टडी है और ये सक्सेसफुल थी कि ये ड्रग एज ए एंटी इन्फ्लामेटरी है. जैसे ये भल्लातक है, भल्लातक को हम लोग यूज करते हैं आम बात में रूमेटॉइड आर्थराइटिस में, जो है वहाँ पर कंसेप्ट ये है कि वो एंटी आर्थराइटिस एंटी इन्फ्लामेटरी काम करता है वो. तो वही जो है कंसेप्ट यहाँ इन्होंने इसको अप्लाई किया है कि नॉट ओनली हृदय कार्डियोटोनिक but as a anti-inflammatory drug, their drug can be effective in curing myocardial infarction or other cardiac disease. तो ये इस तरह की इनकी प्रिपरेशन है, इसको पेटेंट भी कराया है इन्होंने, and it is under process for a clinical trial.
तो इसमें कुचला का रोल क्या हो सकता है सर? स्ट्रिक्टनेस नेक्स्ट वोमिका,
सेम चीज जो भल्लातक का है वो कुचला का हो सकता है, इसे भल्लातक को माना है और कुचला को माना है। और कुचला का जो मेरा एक्सपीरियंस है, ये मैंने देखा है कि कुचला जो है ये हाइपरटेंसिव इसका एक्शन होता है जो है ना, कि बहुत सारे पेशेंट ऐसे होते हैं कि इसको खाने के बाद उनका ब्लड प्रेशर बढ़ जाता है जो है। जैसे लिखा है नर्वाइन टॉनिक है, तो एग्जैक्टली बढ़ जाता है, नर्वाइन टॉनिक है काम करेगा, ब्लड प्रेशर बढ़ जाता है। तो जो पेशेंट का हाइपोटेंसिव है, मुझे लगता है कि हाइपोटेंसिव है या कार्डियक इलनेस में जो पेशेंट लो कार्डियक आउटपुट फेलियर वाले हैं, एक होते हैं हाई और लो वाले, लो वाले का ब्लड प्रेशर भी लो होगा, कार्डियक आउटपुट भी कम होगा, उनका एजेक्शन फ्रैक्शन भी कम होगा, तो डेफिनेटली ये वहाँ काम कर सकता है कुचला जो उन्होंने इसमें इंडिकेट किया हुआ डाला हुआ है। तो अल्टीमेट घूम के जो एक्शन उन्होंने मेन देखे हैं वो एंटी इन्फ्लामेटरी देखे हैं। इन सब को हम लोग कुचला को भल्ला तक को हम लोग जॉइंट डिसऑर्डर्स में या आर्थराइटिस में आम बात में वहाँ यूज करते हैं। तो इन दैट पैटर्न इट कैन वर्क हियर।
तो एंटी इन्फ्लेमेटरी डॉक्टर साहब और भी बेटर है, जैसे कर्कुमिन वो ज्यादा सेफ है या, क्योंकि और इसमें इंटरेस्टिंगली देखिए एक तो ये पेटेंट ड्रग है, मतलब यूएस पेटेंट लिया है इन लोगों ने। दूसरा इसमें गार्लिक नहीं है, जो आप एम्फेसाइज कर रहे हैं गार्लिक के ऊपर, इसमें गार्लिक मिसिंग है इस फॉर्मुलेशन में। और तीसरा इसमें जैसा आपने बताया कि एक्सपेरिमेंटल स्टडी है, जो भलातक है, तो भलातक जो है ये एक सेफ ड्रग तो नहीं है, क्योंकि इसकी टॉक्सिसिटी इसकी टॉक्सिसिटी भी है। तो चलिए सर, थैंक यू वेरी मच। कोई और अगर सेफ ड्रग आपके निगाह में है तो काइंडली इस प्लेटफॉर्म पे शेयर करिए, बहुत सारे लोग टोरंटो में भी वॉच कर रहे हैं आपको।
जी
अगर
ये सर एक्चुअली इन्होंने जो ये ड्रग ली है ना, इनका कंसेप्ट हम लोगों में और है आयुर्वेद में, हम लोग जो जानते हैं कि जो विष औषधियां हैं, जो पॉइजनस ड्रग्स हैं, ये एक्चुअली जो अदर ड्रग के साथ हम इनको यूज करते हैं तो एज ए योगवाही या एज ए कैटालिटिक एक्शन भी काम करते हैं। इनको उन ड्रग के साथ अगर हम ऐड कर देते हैं तो उन ड्रग्स की बायो अवेलेबिलिटी, उनकी एफिकेसी बढ़ जाती है। तो ऐसा भी कुछ कंसेप्ट इनका रहा है कि इनको साथ में ऐड करने से, जैसे आपने गार्लिक कहा, तो गार्लिक को हमको देना पड़ेगा ग्राम्स में, 2 ग्राम 3 ग्राम डोज चाहिए। तो ये जो औषधियां हैं, ड्रग्स हैं, जो विषय टॉक्सिन पॉइजन्स हैं, ये मिलीग्राम्स में काम कर सकते हैं, बहुत ही कम मात्रा में दिए जाएंगे और ये खुद अपना एक्शन तो करेंगे ही, लेकिन साथ में और भी जो मेडिसिन है उनकी भी बायो एफिकेसी ये बढ़ा सकते हैं। ऐसा कुछ कंसेप्ट मान के इन्होंने किया है। बाकी अदरवाइज जो मैंने बताया आपको कि हमारा ये गार्लिक है, गुल है, अर्जुन है, ये ड्रग्स काफी इफेक्टिव हैं, जो कि हम उनको एंटी हाइपरलिपिडेमिक यूज कर सकते हैं। इवन जो गार्सिन या इंडिका जो वृक्षाम्ल बोलते हैं, इट इज वेरी इफेक्टिव। अम्लवेतस जो हमारी जो हृदय औषधियों में है डिस्क्राइब्ड है, वचा है, एकोरस कैलेमस जो कि लेखन औषधियों में डिस्क्राइब्ड है, ये सब मेडिसिन प्रूव्ड एंटी हाइपरलिपिडेमिक है। इनको अगर एज ए मेडिसिन लेना तो उनको ले सकते हैं, और एज अगर डाइटरी सप्लीमेंट हैं या फूड के कंटेंट्स हैं तो वो एज आई टोल्ड कि गार्लिक और अदर एडिबल ऑयल्स उनको हम यूज कर सकते हैं।
थैंक यू सर, थैंक यू डॉक्टर अग्निहोत्री जी। डॉक्टर सोफी जी ने कोई
जी
अपना, तो उनको भी आप ले लीजिए 1 मिनट
लेते हैं। अभी मैं प्रोफेसर राजन जी, जैसे ही प्रोफेसर डॉक्टर हरीश शर्मा जी ने जो कोड रेफर किया यामिनी भूषण जी का जो पेटेंट वाला प्रोग्राम, तो कॉम्बिनेशन देखते ही मेरे को भी थोड़ा स्ट्राइक कर गया कि भल्लातक और स्पेशली कुचला, तो स्टेक्नोस वोमिका के यहाँ तक सवाल है, भले ही उन्होंने पेटेंट ले लिया हो, बट इट इज नॉट सेफ फॉर ऑल द पेशेंट्स सफरिंग फ्रॉम कार्डियक डिजीजेस। क्योंकि शुद्ध कुपीलु जहाँ एक और हम आर्थराइटिस केस में बड़े आराम देते हैं, लेकिन पहले ही बीपी का मॉनिटरिंग रखते हैं कि वो लो ब्लड प्रेशर साइड में बहुत अच्छे रिजल्ट्स हैं। एट द सेम टाइम आपको याद आ रहा होगा डॉक्टर सीके कटियार जी ने अपने पीएचडी वर्क जो किया है वो अपने शुद्ध कुपीलु पर किया है, और 3 मॉडल लिए थे उन्होंने, विद सेल्स लिए है, विदाउट सेल्स लिए और ओनली सेल्स पर लिया है। तो उस पर उनका एंटी पार्किंसनिज्म बहुत ही अच्छा रिजल्ट आए थे, जिसमें उनकी पीएचडी हुई थी बीसी हजार साहब के, प्रोफेसर वीसी कटियार साहब के अंडर में। तो शुद्ध कुपीलु के संग तो डर बना है। जहां तक भल्लातक सवाल है, अगर वो शुद्ध रंग से शुद्धित हो गया है, फिर तो हमारे यहाँ संजीवनी बटी में भी है और वो रसायन के तौर पर ही उसको हम लेते हैं, तो वो तो ठीक है। लेकिन ये जो उनका जो वर्क आपने कहा ना एक्सपेरिमेंटल है, तो ये एक्सपेरिमेंटल एनिमल्स पर हुआ या ह्यूमन पर है? अगर ह्यूमन पर है तो कितने % आया था?
नो सर, ह्यूमंस में नहीं,
ह्यूमन
एनिमल्स
में नहीं है ना, तो डॉक्टर हरीश जी आपको तो जवाब मिल ही गया। फिर
जी, जी,
इसकी
जी, बिल्कुल, बिल्कुल,
फिर इसकी
बिल्कुल।
सेफ्टी क्या रह जाती है?
नहीं, इसमें बीएचयू में तो सबसे ज्यादा प्रचलित प्रोडक्ट पुष्कर गुगुलू था, एस एन
पुष्कर गुगलू
त्रिपाठी
है,
जी के
प्रोफेसर
जमाने में।
त्रिपाठी जी का, यस
तो
वो
मैंने
है।
बताया, पुष्कर ब्राह्मण गुगल पता मैंने बताया
और
तो
पुष्कर गुगलू अपने बीएचयू की फार्मेसी से ही बनता है, बाहर यूपी में या कहीं बाहर बनता ही नहीं, मिलते ही नहीं है।
जी
पुष्कर
नहीं,
गुगलू उनके
उनके
जगह से वाकई मिल जाएगी और चीजें मिल जाएंगी। जी
और पुष्कर ब्राह्मण
त्रिपाठी जी के
और
बेटे की
करवी भी
सूर्या
हो।
फार्मेसी
जी जी जी
एथरोसिड के नाम से बनाती है।
जी जी
जी,
जी
जी, जी,
हाँ,
उसमें
और वो
बिल्कुल
पेटेंट जी।
पेटेंट
तो
है उनका,
जी।
और उनका यूएस पेटेंट भी है।
जी प्रोफेसर पवन जी बुला लीजिए आपने जी सोफी साहब को, उनका भी विचार आएंगे। जी सर।
सोफी साहेब, आदरणीय सोफी साहेब।
जी सर। सर बेसिकली इस एथेरोस्क्लेरोसिस जो है सर, ये वेसल्स की डिजीज है, और यूजुअली जब हम ये ब्लॉकेज होता है इन द वेसल्स बिकॉज ऑफ डिपोजिशन ऑफ दिस एथेरोस्क्लेरोटिक पैचेस, तो उनको खत्म करने के लिए यूजुअली हमारे यहाँ हम कहते हैं कि डी ऑब्स्ट्रेंट ड्रग्स जो सुद्धा को या ऑब्स्ट्रक्शन को खत्म करे, तो उस ऑब्स्ट्रक्शन को खत्म करने के लिए 5 actions are needed. Until these 5 actions are not there, a drug cannot be deobstructed. Say for example, हम कहते हैं कि एक वो दवा लतीफ हो, it should be penetrating, what we say, कि हर जगह पहुंच जाए बहुत जल्दी। दूसरी चीज उसमें ये है कि वो तकती हो, वो काटती हो किसी इस मतलब मॉर्बिड मैटर को। तीसरी चीज ये है कि हम ड्रग को कहते हैं कि वो ड्रग जो है वो मुहल्लिल हो, एंटी इन्फ्लामेटरी हो, ताकि जो उसका जो सॉल्युबल मैटर है जो आसानी से हवा में उड़ सकता है उसको वो उड़ा दे। ये यूनानी में कंसेप्ट है। और तीसरा जो है वो गुस्साल हो, यानी वो वहां पर सफाई कर रहा हो। तो ये 4-5 ये एक्शन जब तक साथ में नहीं चलेंगे तो हम उस दवा को डीऑब्स्ट्रक्टेंट या शुद्ध मुफत्ते शुद्धा नहीं कहते। तो उसके लिए फिर हमारे यहाँ अच्छी खासी दवाएं जो है, से फॉर एग्जाम्पल लुक मकसूल, लैक इंसेक्ट का जो घर होता है उसको हम यूज करते हैं। तो दैट इज कंसिडर्ड वेरी मच इट हैज दीज 5 प्रॉपर्टीज। फिर हमारे यहाँ कुछ नुस्खे जो वेदों ने भी दिए हैं और यूनानी वालों ने भी दिए हैं, जैसे पुदीना है और ये ईर्षा है, हाशा है, ये वेद भी इस्तेमाल करते थे और हम भी इस्तेमाल करते हैं। हालांकि वो ज्यादा पेट के लिए इस्तेमाल करते हैं। और एबेस्थियम, अबसंतीन, इनको जब इस्तेमाल हम करते हैं तो हम कहते हैं कि ये दवाएं किसी भी जगह जाकर के रुकावट को खत्म करती है। तो इस तरीके से हम ये कहते हैं कि ये एथेरोटिक पैच को भी खत्म कर सकती है। और वेरियस रिसर्चेस आर देयर, अभी जो हो चुके हैं रिसर्च, उसमें चाहे एक्सपेरिमेंटल है चाहे कुछ क्लिनिकल भी हुई है, उनमें ये देखा गया है कि रियली दे एक्ट लाइक दैट। से फॉर एग्जांपल हमारे यहाँ एक दवा है धमासा, हालांकि धमासा आयुर्वेदिक टर्म है, हमारे यहाँ उसे कहते हैं बाद आवरण, हैगोनिया क्रिटिका। वो हम ये मानते हैं कि ये बहुत ही अच्छी दवा है सुद्धा को, ऑब्स्ट्रक्शन को खत्म करने के लिए। और अभी हमने जो देखे तकरीबन 5 या 7 स्टडीज ऐसी है जो ये दिखाती है कि हाँ इट हैज द इफेक्ट, कि ये मुहल्लिल भी है, ये एंटी इन्फ्लामेटरी भी है, और ये डायलिटेशन बढ़ा देती है, जिसकी वजह से आसानी से सुद्धा दूर हो जाता है या ऑब्स्ट्रक्शन खत्म हो जाती है। तो इसी तरह से एक और दवा है जो हम यूज करते हैं अक्सर, जो तुलसी की एक किस्म है, उसको हम मर्जन जोश बोलते हैं, जिसको हम इस्तेमाल करते हैं इसके लिए कि ये बदन में जो है, जो जिस्म में है, बॉडी में जो है ऑब्स्ट्रक्शन को खत्म करती है। तो उसको जब हम इस्तेमाल करते हैं तो उस पर अच्छी खासी स्टडीज भी ऐसी है कि वो एथेरोस्क्लेरोटिक है। तो इस तरह से अगर हम, मैं कोरिलेशन के कायल नहीं हूँ, लेकिन अगर हम डेटा को कंपाइल करेंगे तो हमारे पास बहुत सारी चीजें आती है जो हमारे अपने कंसेप्ट के हिसाब से कि रुकावट को खत्म करने वाली और किस तरह से रुकावट खत्म होती है, तो हमारे पास अच्छा खासा डेटा जमा हो जाता है। बहुत सारी ऐसी ड्रग्स हैं, और फिर कॉम्बिनेशंस तो इट इज इन हंड्रेड्स, यूनानी में हंड्रेड्स ऑफ कॉम्बिनेशन ऐसी है जो हम रुकावट को खत्म करने के लिए यूज करते हैं। तो उनमें से एक जो अभी जो पेपर का आपने छेड़ा, लेकिन ये जो है ये सिर्फ एंटी इन्फ्लामेटरी और नर्वाइन स्टिमुलेंट है। हालांकि नर्वाइन स्टिमुलेंट हम जब कहेंगे तो अगर वो पोस्ट साइनेप्टिकली देखेंगे तो वो इनहिबिटरी होंगी वेसल्स पर, तो उस वजह से मुझे ये इतना अच्छा नुस्खा तो नहीं लग रहा है, प्रेस्क्रिप्शन इतनी अच्छी नहीं लग रही है, लेकिन ओनली क्लिनिकल ऑब्जर्वेशन विल टेल कि ये सही हो सकता है या नहीं हो सकता है, बट हाइपोथेटिकली आई विल से इट विल नॉट गो फार, वेरी फार। तो सर ये
जो लेक्सीफेरस आपने जिक्र किया, थोड़ा और इसमें डिटेल बताइए अगर आपका कोई एक्सपीरियंस हो, जो लाख आप बता रहे हैं।
ये हमारे सर यूजुअली रूटीन प्रैक्टिस में हम लैक इंसेक्ट को यूज करते हैं, लैका लेसिफेरा, उसको हम इस्तेमाल करते हैं इसके लिए एंटी ओबेसिटी और एंटी स्क्लेरोटिक भी, एथेरोस्क्लेरोटिक।
आपके हिसाब से क्या रिजल्ट्स हैं इसके?
सर दे आर वेरी गुड रिजल्ट्स, क्योंकि इस पर हम लोगों ने शायद अलीगढ़ में भी काम किया है और यहाँ भी इस पर काम हुआ है। फिर लेकिन एक बहुत अच्छी कॉम्बिनेशन जो है वो राजस या उसको अबू बकर जकरिया राजी, जो 11वीं सेंचुरी एडी का बहुत बड़ा हकीम था, उन्होंने एक फार्मूला लिखा है लुक मकसूल मर्जन जोश, और उन्होंने एक और दवा उसमें डाली थी बरगे सुद्दाब, रूटा ग्रेवियोलेंस, उसकी लीफ। तो उसको मिला करके जब उन्होंने दिया तो इट इज वेरी मच इफेक्टिव। इसी को हम अब इस लुक मकसूल के नाम से या सफूफ मुहज्जिल के नाम से यूज करते हैं। सफूफ मीन्स पाउडर, मुहज्जिल मीन्स जो ओबेसिटी में कमी कर देता है। तो विच इट इज आवर रूटीन प्रोडक्ट नाउअडेज।
ये बड़ा इंटरेस्टिंग है क्योंकि हमारे यहाँ लाक्षादी गूगल एक दवा आती है,
अच्छा,
आयुर्वेद में बहुत मशहूर दवा है, गूगल के साथ लाक्षा का कॉम्बिनेशन है, लेकिन हम लोग ज्यादातर उसको फ्रैक्चर्स के लिए, ब्रोकन बोन्स के लिए, हड्डियों के लिए यूज करते हैं। लेकिन आपने जो बताया कि लाक्षा जो है ये एथेरोस्क्लेरोसिस में काम करती है, बड़े कमाल की इंफॉर्मेशन है। थैंक यू सर, थैंक यू वेरी मच। हम इसको जरूर अप्लाई करके देखेंगे।
सर इसमें ये तुलसी जो बन तुलसी है प्लस जो ये बरगे सुदा रूटा ग्रेविलंस है, इन तीनों को मिला करके, क्योंकि ये हमारा क्लासिकल नुस्खा है फ्रॉम 11वीं एडी, जिसको हम आज भी इस्तेमाल करते हैं और वी गेट द रिजल्ट्स।
दोबारा बताइए सर, एक तो लाख हो गई, एक बन तुलसी
और ये बरगे सुदा रूटा ग्रेविलंस की ये पत्ते
जी,
उसको हम यूज करते हैं सर, तो अच्छा रिजल्ट आता है अपने यहाँ।
थैंक यू सर, थैंक यू सर। ओवर टू डॉक्टर पवन जी और डॉक्टर अग्निहोत्री।
थैंक यू सर, थैंक यू डॉक्टर हरीश वर्मा जी, thank you Dr. Rajendra Prasad ji, and also thanks to Dr. G. Sophie ji for their questions, answers, discussions, and for their all enlightenment to this gathering. Thank you very much. Meanwhile, when we were discussing about the medicine related to atherosclerosis, we got information in chat box from Dr. Hema Malini. She narrated that the overnight soaked hibiscus flowers, say him, along with the Lasun Chirpak is of wonderful results as far as the atherosclerosis is concerned. She has mentioned in this chat box. So thank you, Dr. Hema Malini ji also. But I don't know what is the reference of this and how it is been experimented and what are the say success results of this your information. So even then, thank you very much. If you have got an information, as you are our guest speaker today also, you have given your talk on this subject itself. You are invited that if you can give your some feedback along with your this information as far as the clarification is concerned. Thank you.
With your kind permission, lastly, I would like to request Renu Rathi ji.
Sure, I
from Maharashtra.
Sure. I was willing to. Even I would like to say that all the present dignitaries who are here in our platform, without wasting time or for the sake of saving time, those who are having any suggestions, questions, or add on something, they please come forward by their own, by raising their hand or just clicking, so that we can have more or more thought within and before 10. Thank you so much. Thank you, Dr. Pawanji. So,
thank you, sir.
Both these doctors are here. If Dr. Hema Malini wants to come first, she can narrate a few sentences on her information, and then we would like to welcome Dr. Rajendra. please.
So I'll wait for Dr. Renuji, sir.
Whatever. Now it is up to you people. Dr. Renu, would you please come forward first?
Yeah, okay,
And
thank you. Pranam to everyone.
As invitation is given by Dr. Pawan Sharma ji and seconded by me. So
Yeah,
please.
thank you so much.
Thank you.
Pranam to everyone.
Thank you.
My little question is that I heard that green chili or red chili powder is very much beneficial whenever attack is going on. So what is the logic or what is the scientific basis? I want to listen from all dignitaries.
So your question is addressed to which dignitary? Sophie ji?
Anyone, whosoever.
No, Sophie ji, your question is coming on the grounds
Prasad
of
sir. Prasad sir.
Dr. Prasad sir. Dr.
Yeah.
Prasad sir, you are here. Would you please
Actually, I have already answered in the chat box. It was question by Dr. Renuji.
Oh yes.
But these are the things, the red chili, I don't favor the red chili, but the green chili and the other thing, I think the garlic or the adrak.
Ginger.
Ginger. Yeah. They are, they have a specific property, having the specific ras, specific vir, specific vipak. And definitely, if we say in the terminology of modern medicine, they are clearing the channels. They can work as Sruto Shodhan. So in that, as Dr. Sarmaji is asking from the Canada, Toronto, and many other people are discussing that in cardiac issue, the main pathology is that atherosclerosis channel blockage are there. Either the blockage is temporary or it is permanent, due to which the proper blood supply is not there to the particular part of area of the heart. So these drugs can be act as Sruto Shodhan. Srutavrod is in any form, Srutavrod is there. So by giving them, there can be immediate, the blood supply can be improved, it can be better. That way it can provide relief, but I don't have any personal experience that can be given. But it my humble submission that it can work as Sruto Shodhan. Blockage, maybe for temporarily it can remove, or it can be say the temporary vasodilation, coronary vasodilation can be there, that can provide relief in the acute cases of MI or other ischemic heart disease. That's way. Otherwise, I don't have any personal experience.
Yeah, thank you so much. What is your experience regarding Hemgarba Puttali?
Hemgarba Puttali, this actually we are not using in cardiac illness, rather than we are using in the cases of chronic cases of Grahani or Sangrahani there, because it is having some specific contents like Swarn Bhasma or sometimes like Kasturi, like some specific contents are there. Many of them are not available nowadays, but we are not using it there. In heart illness, cardiac illness, we use the Vrata Chintamani or other Swarn Yogas, but maybe it can be used because it is indicated somewhere for the cardiac illness, severe heart disease, so it can be used there, but we are not using it here.
Right, thank you so much.
Thank you, Dr. Prasad. Thank you, Dr. Renurati ji. I can say that, Dr. Prasad, can you like to suggest the use of chili, red or green, in any form, that may be in a form of golgappa or chutney, for the prevention of cardiac disease as such, because our Renurati is definitely belonging to our side, and ladies are always fond of getting sour and acidic, say, taste along with chili. Without it, it doesn't come to the optimum taste. So anyway, chili preventively is useful.
Green chilies are effective in many ways.
Right.
It has very good antibacterial actions are there, antioxidant actions are there. And so in any form, or right now we are talking about the Hradya Mahakasa, Hradya drugs. And Amla Ras Pradhan is there. And that Amla Ras means khatta, sour. That is effective, that is beneficial for cardiac illness or they say hyperlipids. So if we are combining that, I think green chili along with some Amla Pradhan drug and the ginger, then that kind of paste can be useful. Along with, no doubt, Sandhar Lavan should be there, because Sandhar Lavan that contains a low sodium content, which we are in cardiac illness, we avoid the high sodium. Low sodium containing salt along with green chili and the ginger along with some Amrit Pradhan drug from the Hradya Mahakasaya. That kind of test can be useful for heart disease.
So it can be hypothetically inferred that the ladies fond of having acidic and sour taste are far away from the cardiac problems.
Yes, sir, definitely it is there.
This is what they are always interested taking.
Yes, sir. So data is there. Data is there in case of female before menopause. Before menopause, there are very little chances of getting heart disease. Whenever the menses stops after menopause, the cardiac illness starts, because at that time she feel that I'm getting old, so I should not take that type chaat pakoda golgappa. This they are not taking.
I think this was really our acharyas Diddushu Gyan Chakshusha. This was what they were inferring in that way, and the matter is there in that text. We are scared to follow and to analyze in that manner. Thank you so much, Dr. Prasad. Thank you so much. Now I would like to invite Dr. Hema Malini.
Logic behind it that whenever the proper amount of estrogen is there, proper enough estrogen that prevents from cardiac illness. But when after menopause, the contents of estrogen getting reduced, then they are getting the cardiac illness.
Very correct.
It is different way, but definitely.
Very correct. Teachers like you are always needed to clarify all these so-called running principles in the manner they have been accepted and coming traditionally. But we are just scared that why they are so doing and why they are away from the disease. Well, thank you so much, Dr. Prasad. And I would like to invite Dr. Hema Malini ji for.
Before that, I would like to communicate that on 2nd October, no alcohol day is there, World No Alcohol Day. And on 3rd October, World Alcohol Free Day is there. So we have invited a team of Nasha Mukti Andolan dignitaries, Dr. Akhilesh Bhargav, Dr. Ritu Kapoor, Dr. Professor S.P. Singh from Homeopathy Principal, Dr. APS Chauhan, Dr. Nidhi Jain from Allopathy, and Dr. Nitin Urmalia. So this is just for information, and on continuous request from everybody that we have given gap of 3 days, tomorrow, day after tomorrow, and 2nd October. So please excuse me for discontinuity. We will be meeting on 3rd, but time will be for 4 to 6 because everybody wants to visit here and there. So 4 to 6 we will be meeting there.
No problem, sir. Everything is very important, and Ati Sarbat Varjet. If we are so continuously doing a lot, our mind and body also means needs some rest. So that gap will be taken as a rest and for rejuvenation, for re-energizing.
लेकिन फिर भी बीच में मन नहीं माना है, तो आप सबको मैंने अक्टूबर का प्लान मैंने सबको फॉरवर्ड किया है. प्लीज आप लोग मेरा सपोर्ट कीजिएगा. मैं नई नई प्रतिभाओं को, नए नए वक्ताओं को चाहता हूं कि आप लोग रिकमेंड करें. आप लोग अपना भी खुद का चॉइस मुझे बताएं कि किस दिन आप बोलना चाहेंगे. ये सब यदि मेरे लिए बड़ा आशीर्वचन होगा तो प्लीज रिकमेंड योर नेम, your friend's name, expert's name, and new talents we would like to invite on our platform. Thank you very much. जी हरीश जी कुछ बोलना चाहते हैं?
जी डॉक्टर अग्निहोत्री जी, यहाँ पर वेस्ट में लाल मिर्च के कैप्सूल मिलते हैं.
हाँ, अच्छा.
केन पेपर, इसे केन पेपर कहते हैं, और ये बहुत इफेक्टिव पाई गई है. जो रेड पेपर है कैंसर में, इसकी स्टडीज आई हैं.
अगर आप पिज्जा के साथ में तो आते हैं रेड चिली के फ्लेवर्स आते हैं ना, छोटे छोटे.
नहीं, इसके कैप्सूल्स आते हैं. ये मैंने जो भी दिखाए हैं. वो कैसे
देसी घी से खाते हैं, काय से खाते हैं? वो तो पूरा जीआई डिस्टर्ब कर देंगे मॉर्निंग तक.
नहीं, इसमें नहीं, ऐसा नहीं है. ऐसा नहीं है. वो सारा एक फार्मास्यूटिकल प्रोडक्ट. तो इसमें देखिए एंटी कैंसर प्रॉपर्टीज हैं. इसमें जो कैप्सेसिन पाया जाता है, इसकी एंटी कैंसर प्रॉपर्टीज ह्यूमन कैंसर में पाई गई. और एक कैप्सूल आते हैं. यहाँ बहुत लोग कैंसर पेशेंट इसको यूज करते हैं, कैन पेपर। जो आप कह रहे थे ना कि लाल मिर्च की चटनी खाते हैं लोग कैंसर के पेशेंट, लेकिन अगर हम देखें इसका प्रभाव वही है, लेखन है, कफनाशक है, और
सर कैंसर ऑफ विच पार्ट?
इसका तार्किक अर्थ ये समझ पाएंगे सर कि वहाँ का ठंडा क्लाइमेट है, जो मैं आशा करता हूँ, और यहाँ का पित्तवर्धक ऑलरेडी हॉट क्लाइमेट है, तो यहाँ मिर्ची ऑलरेडी जला मारेगी, वहाँ मिर्ची चेतना देगी, जिंदा रह जाएगी। मेरा एक चाइल्डिश मन में है।
बिल्कुल बिल्कुल, देश काल प्रकृति, ये तो चिकित्सक को देखना ही पड़ेगा कि देश किस देश में, किस काल में, किस प्रकृति में हम द्रव्यों का इस्तेमाल करते हैं।
कैंसर किस पार्ट का है? जीआई का तो नहीं होना चाहिए ना, जीआई में तो डिस्टर्ब करेगा।
ये ज्यादातर प्रोस्टेट कैंसर के लोग लेते हैं। प्रोस्टेट कैंसर में इसकी स्पेसिफिक स्टडी भी है। जी सर।
एक्चुअली कैप्साइसिन ये भी एक एंटी इंफ्लेमेटरी एक्शन इसका है जी। हम लोग इंडिया में बहुत सारे ऑइंटमेंट यूज करते हैं, लोकल ऑइंटमेंट जो है पेन किलर्स के लिए, आर्थराइटिस वगैरह के लिए, तो कैप्साइसिन उसमें पड़ा होता है, तो एंटी इंफ्लेमेटरी है और लोकल ये काम करता है काउंटर इरिटेंट, कि लगाते ही बिल्कुल बॉडी लाल हो गई, पूरा का पूरा उसके अंदर एब्जॉर्ब हो जाएगा, उसकी जो एब्जॉर्प्शन की क्वांटिटी बढ़ जाती है, एंटी इंफ्लेमेटरी भी है, तो मे बी एक्शन होगा। निश्चित है कि हम लोग यहाँ करकुमिन ज्यादा यूज कर रहे हैं एज ए एंटी कैंसर।
बहुत अच्छा लगा सर, बहुत अच्छा लगा।
दूसरा वो भी था ना, मरचाई तेल लेते हैं, उसमें मरीच डालते हैं।
एग्जैक्टली, मिर्च डालते हैं,
मरचाई तेल भी तो है उसी में, तो वही है
मिर्चा दिए। लोकल एप्लीकेशन,
लोकल में तो लगाते हैं, लोकल में तो कर सकते हैं। मरचाई तो बहुत जीवंत उदाहरण है।
अदरवाइज हम लोग आयुर्वेद में इंटरनल यूज के लिए काली मिर्च यूज करते हैं, कृष्ण मिर्च जो है, लाल मिर्च बहुत कम यूज होती है, ग्रीन चिली खाने में उसका इस्तेमाल है। और
ठीक है सर, थैंक यू डॉक्टर प्रसाद जी।
अग्निहोत्री जी
सर अरे आइए जी,
बहुत तो नेग्लेक्ट करते हैं आप सब्जेक्ट पे। एक चीज जो रेड चिल्ली खाते नहीं है उस एरिया वाले ने ही ज्यादा डिस्कशन कर रहे हैं, और जो रेड चिल्ली खाते हैं तेलंगाना, आंध्रा, ये एरिया में, हम लोग उनको चांस नहीं देते हैं बात करने के लिए।
आंध्रा वाले खाते हैं, हमारा VLN शास्त्री तो लाल चिल्ली का ही विचार लेते थे, जबरदस्त। BHU तो नागार्जुन बट्टा था।
अग्निहोत्री जी जरा सा सुन लीजिए
जी, बताइए।
अपने यहाँ तेलंगाना में जो कोई पुरातन वैद्य थे, वो लोग पक्षी का आहार लगाते थे समय पर लहसुन का पाउडर और रेड चिल्ली, लहसुन और रेड चिल्ली का पाउडर ही दे देते हैं, लेकिन घी के साथ खाना पड़ेगा, घी के साथ। यहाँ पर चमत्कार देखिए, वहां पर कोई सनफ्लावर से नहीं है। सनफ्लावर इज थर्ड क्लास व्हिच इज कंसिडर्ड। palm oil and sunflower, these two are categorically in Ayurvedic system not at all to be considered. But I don't know, you have put up that also in your discussion. These two are least observed in Ayurvedic system. They are not good for health. Let us go for clinical. Only the thing is this cholesterol is not developed. And what cholesterol? Whether good cholesterol or bad cholesterol? And one another thing, I don't think that it will become an irritant when I pose a question to our Prasad ji, that how can it be a combination of ginger and green chili? Both are irritants in the mucous membrane. Either one can be according to the prakriti of the need. These two cannot be combined, either ginger or green chili. But in the combination you are referring, these two are mixed. I couldn't get convinced. And the another thing is this: out of the medicines which are referred, I couldn't hear properly because a patient who has undergone 3 stents introduction for vascular system, he was sitting at my consultation and asking for that rejuvenation, and also insulin dependent patient. And in the meanwhile, I said that you go to the your cardiac specialist and cardiologist and take the medicine. I don't prescribe you because already 3 stents have been given. This is the condition. Whereas they ask for aphrodisiacs. Can we very freely prescribe? No. And here, out of the medicines, am I audible, Agnihotriji? Hello?
Yes, your sound is coming. Yes, yes.
Okay. Is it audible?
Yes, yes,
okay.
yes, please. Yes,
Agnihotriji.
Yes, sir.
Out of the referred medicines, none have referred about the efficacy of Hridayanavrus or Nagarjunavrus. Are they useful in any style or in any element of cardiovascular system? And at the same time, if I read a sloka out of Basavaraja, then it will be something a wondering, because here in this book it is in Telugu. Here it itself is mentioned by Mulugu Vishweshwara Shastri that whenever there will be cardiac failure and getting, that means seconds counted on the finger or in brain, then can this be medicine be administered, will invigorate and at the same time strengthen the heart for palpitation. That is sloka I am reading. Gandhakam tankanam chabrakam nabhi datura bijam krishna sarpasya garalam rakta chandana vangakam etani samabhagani sarvatra samahingullam matulunga rasarmartyam tridinam cha mahamruduhu vatukan sarapaka rasanupana visheshata sarvajwara nivaranaha. Here he referred sarvajwara nivaranaha because all the Ayurvedic system are first discerned on Jwara basis. That is why it is the reference. But at the same time, it has been referred with Krishna Sarpa Garalam in this formula. It is referred. Likely, there are so many formulations which are away of our reach, and entire North is not knowing about Basavaraja well. Whichever may be one or single medicine from Jandu. That is Shitamshuras. That is Basavaraja Yoga. Thank you very much.
Sir, thank you, sir. Thank you, sir. I think that as far as the Hridayanavrus and Nagarjunavrus is concerned, Dr. Prasad touched this area and categorically talked about the Vatik, Pettik and Sleshmaj Vikar of Hridayanavrus as far as the Hridayanavrus is concerned. Now the time is almost complete. So with this note that Dr. Hema Malini's concept of that hibiscus flowers overnight, this hymn along with Lasun Chirpak is tentatively be useful. And as time is stuck, and we thank all the dignitaries who joined today's platform on 458th, along with our 4 guest distinguished speakers. They touched all the areas. They externally was outside the body, but internally they touched even the pericardium, the whole mediastinum, the both lungs, and along with our all the chambers of heart, with the wellness and its performance, its anatomy, its physiology, its emotional attachment, its spiritual part. I started when I talked about. So our thanks, our regards to all the guest speakers, along with all the dignitaries who joined today's speaker. With these words, I thank you all. Pranam, namaskar, dhanwad, Shivati, and over to Dr. Pawan Sharma ji.
Good night.